Good morning. It is Friday, November 14th, 2025, and the time is 9:07 a.m. I can't look at my phone. And this is Veronica Bolchik, and I'm the chair of the Contract Review Committee. And this is our meeting during which we will be interviewing some of our grant applicants. So this meeting will be conducted in a remote fashion. So all votes, if we need to take votes, will be done by roll call. So the first thing is to establish quorum. So I am looking up on the screen and I see John Balash here. Please respond, not just with a hand. So,
Here.
okay, thank you. And Suzanne Keating.
Here.
And
I'm
I
here.
know that Linda Williams is there.
Yep.
And I know that Lee Tesser is there.
Here.
And Joanna Roach is there.
Here.
I'm not. All right. Did I get everyone? Because I'm not seeing the entire screen right now.
Before
Let me
you
see if
keep
I-
going, Veronica, do we have a baby yet?
Yeah.
Yes, yes. Yesterday, November 13th at 4:13 a.m. and it happened to be Kerry's birthday. So what a wonderful birthday present for Grandpa. Murphy June McKenna joined us and she is healthy, came home from the hospital 6 hours later, and
Wow.
today we got her out. A much different medical system here for sure. Anyway, thank you very much.
Congratulations.
Thank you, thank you. So I'm recording here from the Sunshine Coast in Australia, and a happy new grandma. So thank you. So we do have a quorum, and also let's recognize the town staff we have. So Jericho Maley
Here.
and Lexi Richards, I'm sorry. Thank you. All righty.
And Sue has joined us. Sue Minton.
She is joining as
Well,
a
Sue is here as a member of the public today because she's
Oh, okay.
representing a organization. All right. So we will be having people join us, I think, during the morning and I'll turn to Jericho. You know, can we just recognize them when it's time for their interview? Because that would be, it seems like the most logical thing for me.
Yes, when I'll refrain from introducing people when they join. I'm also going to do the impromptu timekeeper as everyone has about 10 minutes per presentation. And we are now running into the start time for the first presenter, Jennifer Frazee.
Okay. All right. So quickly, we just need an acceptance of our agenda by roll call. So we have Linda.
I'll make a motion to accept the agenda.
I'll
Okay.
second it.
Thank you. So by roll call, Linda,
Aye.
John,
Aye.
Lee,
Aye.
Joanna,
Aye.
Suzanne, and myself. Okay, we have an agenda. Public comments will come as we have our interviews. So this morning we are starting with a safe place, and is Jennifer with us?
I'm not seeing Jennifer in person or online.
Okay.
I would suggest that given we have PASCON's representatives here, if they're amenable to hopping in just in the interest of time, that would be ideal.
Okay.
I don't have a problem doing that.
Okay. And are they in the trail?
No,
in the
they're
trail?
both, we have Sue and Andrea presenting for PASCON.
Okay. All righty. If you would like to,
Oh, hold on, I have Jennifer joining right now. Apologies, just dangling just pulling the thing out of the way, sorry. Hi, Jennifer.
Hello, good morning.
Okay.
Good morning.
Good morning, Jennifer. You are our first interview for today. Best if you give us a overview of your application and we'll take it from there. And if we have any other questions, we will give, you've got 10 minutes. And don't feel that you have to take the whole 10 minutes if not necessary. So, thank you, Jennifer.
Well, thank you for having me here. Thank you for reviewing this application. So this year, A Safe Place is requesting $75,000. It is in many ways for those that have been on the committee the last couple years. I think the grant itself is pretty much the same as the last couple years. We are asking for funding to help in the following areas with our urgent crisis services, which is our 24-hour hotline, and then our advocates are available 24 hours a day through that hotline. So any time of day or night, weekends, etc., we'll respond to the police department or to the hospital in the aftermath of domestic violence and sexual assault. And we have very good working relationships with the hospital and the police department, as well as the courts. So we're always available for the courts as well. So when victims or survivors respond to those locations, all of those entities will call us to go there to support survivors in those locations. So this grant is also covering all of that, the court advocacy, the medical, and the police advocacy 24 hours a day. It's also to cover the ongoing counseling and occasionally therapy in the aftermath of those domestic violence and sexual assault crises. And then a huge part of our mission too is conducting outreach to the community. We just, we want as many people as possible to know about our free and confidential services. So a portion of this grant also goes to that outreach and community education and a lot of prevention education, especially with youth in the community as we try to end abuse in our community. This particular grant also helps fund what we call the Beacon Project with the police department. So it's a unique way to try to intervene earlier on in the cycle of abuse by working very closely with the police department. And every single time that they get called out to respond to a case of domestic violence, they're handing the identified victim a packet, the Beacon packet. In there is a letter from A Safe Place, Chief Casper and myself. It describes this project that we're trying to, eliminate violence and abuse on the islands. And then from there, there's a few more steps, but essentially what happens is our advocate gets the identified victims information, contact information, and we're able to reach out to that victim to be able to offer support, hopefully earlier on in that cycle of abuse than if we were not doing this project. So we have found that it's very valuable in the community. So we also use this grant to help with some enhanced culturally and linguistically specific services. In particular, we've been working with a couple of off-island organizations, Source Hub and the Brazilian Resource Center, to both educate our staff and also help us conduct outreach in the community, especially to the Brazilian community, because we had just identified that in particular as a group that was underserved at A Safe Place. I think we do a wonderful job reaching Spanish-speaking individuals. But there's always room to grow, so we're looking to grow there as well. But it's been wonderful working with these two organizations, and we hope to continue with that. And so part of this funding would help us be able to continue those collaborations to try to reach the immigrant community as well. So I think I'll kind of stop there and see maybe if anyone has any specific questions.
Any of the committee have any specific questions that Jennifer didn't cover? All right.
Jennifer,
Yes, Lou?
yeah, good morning, Jennifer, and thanks for the application. I did have one question looking at your application about the program budget. I don't know if you have it in front of you, but the anticipated program budget appears to be less than the fiscal year 25. I just wanted to kind of understand that. I didn't know if I was reading it wrong. Perhaps
Okay.
you could just give some clarity on that.
Yes. So the difference is in the fiscal year budget, that was total operating budget. So that does include a couple other programs that I'm not asking this particular grant to fund. So we do have a supervised visitation program, and so that funding is completely separate. And then we have another children's program. So that difference really is because I'm not counting those couple of programs there.
Okay, yeah, thank you for that.
Okay, and to understand those programs are completely funded?
They are, yes.
Okay.
Yes.
All righty, thank you. I have a question about the Brazilian Resource Center. That is off island, or do we have a Brazilian Resource Center? I was unaware if we had one on the island, and I thought maybe part of the Family Resource Center. So if you can clarify.
Oh, yeah. No, the Brazilian Resource Center is located on the Cape. So there's
Okay.
not one here. I know we do have like the Immigrant Resource Center here. I know for a while it wasn't all that active. I think they're trying to become more active here, but the Brazilian Resource Center is off island, so on the Cape.
Okay, and they provide services as needed for you?
Yeah, so what they do, they have been helping us become more educated as staff in terms of like how to conduct outreach to the Brazilian community. They're helping us connect with that community. And they have this wonderful, I don't know if anyone's seen any of these advertisements. I know Jericho and I have emailed about it before. So they offer on the Cape these free mobile medical clinics. And it's really a way to be able to conduct, it's volunteer doctors and nurses. And they really are serving the Brazilian community, but also opening it up to other immigrants, the homeless or unsheltered, and people that don't have health insurance. And so we've been able to partner with them, and we have now hosted 2 of those free mobile medical clinics at a safe place. And we have another one scheduled for December as well.
Wonderful. Well,
Yeah.
thank you for your explanation. And also congratulations on your new home and permanent location. So
Thank you.
that was quite a feat, and wish you well there.
Thank you.
Any other questions for Jennifer?
I had one last question, Jennifer, real quick. At the end of your application, you mentioned the funding cuts, and of course, we're all sensitive to that. But what do you know as of today? What might happen in terms of funding cuts?
So what I know for sure, just 2 weeks ago, I found out that our rape crisis program is receiving about an 8% cut from the Department of Public Health. So that equates to about $18,000 this current fiscal year and $30,000 in fiscal year 27. So that's what is absolutely known. There is also another funding source. It's federal money that we receive through the Massachusetts Office for Victim Assistance. And that has, in general, received a $10 million cut. And we are currently handing in competitive grants on that. It's open for competitive bid. And so we have been told to expect hits there.
Okay,
Thank you.
thank you.
And I just wanted to mention I'm just speaking up for the time.
Yes, thank you. All righty. Well, thank you, Jennifer. If there's no other questions, we appreciate your explanation and best wishes in this coming year. And we will see you again soon. All righty.
Okay.
Thank
you
you.
all.
Have a
Bye-bye.
great day. All
You
righty.
too.
Okay. Before we go on to the next interview, just because this is being conducted remotely, before your question, if you're not recognized by me, please state your name so we'll have that for the record. All right. Thank you. All righty. So next we have Pascon, and I believe we have Sue Minthanen. And I don't
Andrea Giletti, I believe is the pronunciation.
Yes.
okay, and they're both on the screen, so we will turn it over to Pascon. So thank you for being here today, and the floor is yours.
Thank you, Veronica, congratulations.
Thank you.
And thank you all for having PastCon today. It is a little nerve-wracking sitting on this side of the table, so to speak. Lee, you're not aware I was on the CRC up until this past fall, this summer,
July.
I guess. July,
Yep.
yeah. So I appreciate the work you're doing, absolutely. So Andrea and I have come today. Andrea is the co-chair of our board to talk about PastCon. Our application is kind of based on the overwhelming, at least to me, salary increases we've seen over the last 5 years. Part of that's just the way of the world. Part of it's that we've had a huge market adjustment in our pay scale through MGB, NCH. And we are now planning to add some per diem hours because our census is continuing to grow. And I feel like we kind of determined we've hit a tipping point in terms of how many people we can keep on our census and continue to provide quality care. So we are looking to add more time, more staff time. One of our main core parts of our mission is to keep our care free of charge to all people with serious illness. We do not want to collect insurance information and try to get reimbursements, partially because that is a barrier for a lot of people to get care, and partially because palliative care services are this amorphous thing in American medicine system. And we did research over the last year, and most of those services we provide are not covered under Medicare, Medicaid, or private insurance. So the cost to try to get those funds would actually just cost us more money than we would get back. But we thought it was important to do the due diligence and see, like, are we missing a revenue stream? And we are not missing a revenue stream there. And in fact, most programs, palliative care programs, are sort of embedded other places in the nation. They're embedded in oncology programs or hospice programs, because those are sort of where the money is made. And the palliative care is just a nice thing to have if you happen to have a specialist in your system. So Nantucket's really unique that they have PastCon, where, our own department of the hospital, Andrea and I represent the foundation that funds, we underwrite that department of the hospital. And we are able to provide care to people with any serious illness. We're not tied to an oncology program specifically, or a cardiac program, or a liver program. We see patients of all kinds with any serious illness. And then lastly, our request includes funds for community outreach. We had funds in fiscal year 25 from the CRC that were primarily spent on outreach, and we found that it was very helpful. You all kindly sponsored a palliative care week with us, which we hosted 4 workshops in the hospital and 1 workshop at the Athenaeum. And we were able to invite the public as well, the general public, as well as staff members at the hospital, to participate in these workshops that included, living well with cancer and having spiritual conversations during serious illness, learning how to fill out healthcare proxy forms, and helping families talk about what people's healthcare wishes are. And those were attended by, I believe, over 60 different people, and that's the ones that signed in and out at the door. So there may be more that passed by our clipboards, but the ones that did sign up officially was at least 60 different people coming to these workshops. And again, it was exciting that members of the hospital staff could pop in on their lunch break, get some lunch and some continuing education, because it's not just the citizens of Nantucket and the general population that need to know about our services, but we find we're constantly educating healthcare providers about how we can benefit their patients. People get very frightened of the word palliative. They connect it with hospice, and nobody wants to tell their patients that have a chronic serious illness that they need hospice care. And we're not hospice care. We love hospice care, but we're for everyone. Your prognosis is not what decides if you qualify for palliative care. We just want people to be comfortable throughout their illness, regardless of what their journey is going to look like. So that is a big part of our public awareness, education, and outreach work.
Okay.
Andrea, do you have anything you want to add that I missed?
No, thank you so much, and Sue, and good morning, everyone. I just wanted to add that Deb Dolan, our nurse practitioner, is the only palliative care certified practitioner on the island. And she's made amazing strides with our island home. When she came to us almost 4 years ago now, we didn't have any clients at our island home. And now the census for our patients is 14 within our island home. So that's an interesting aspect of her practice that a lot of people don't know about. And she's also working collaboratively with Bob Eisenson, has developed a good relationship with EF Senior Care, who are the managers of the care at our island home. So that's significant. And we have a new website now, which we've just completed. And on that website, you'll see that we administer the Marla Lamb Fund, which is wonderfully funded by the community. It does take many hours of our office manager's time in order to administer that. So that's another, an added burden to the service, but we do maintain that.
Okay. All righty. Does the committee have any questions that was not covered?
No.
Okay.
Oh, I would like, if I could, to plug one more thing in, which is that we see patients anywhere. They don't have to come to the office. They don't have to be inpatient at the hospital. We go to homes, we go to the nursing home, we go to Sherburne Commons. We see patients when they're in the infusion center, if they're already here. So we're not limited by any set of walls, which is
Okay.
great that they can go to people's homes.
Okay, Sue, I do have a question. When I look at the anticipated program reach people served, and I believe you have it at 700 for fiscal year 27, and it was 627 for fiscal year 26 estimated. That is individual patients that you are seeing, or is it patient and caregivers? Because when I looked at that, I was surprised with the volume, but I know that your reach is quite large. Like you said, it's not just it's not end of life. It is supporting a better life for someone faced with a debilitating situation.
Right.
So
So that number would include patients, people with illness that we are treating, caregivers, people who come to our support groups, which you don't have to be receiving PASCON care to come to any one of our support groups,
okay.
or going to counseling, which sometimes we kind of look at as an additional number to our patient census. And as well as people who come in with questions for our staff about filling out, I think it's called the Andrea, do you know what the MOLST stands for? It's like an advanced care directive.
It is, it's a medical order of, um,
End of life.
end of life, yes, yes.
Yeah, so people can come to us with that. People come to us with the Marla Lamb Fund, and people who come to Palliative Care Week. So those number, the 700 number, is sort of how we hope to interact more directly with people, whether it's through coming to programs of ours, educational programs or clinical.
Okay, and thank you also for including in the application the survey that you give to your clients, because, and I believe you said that through the applications or the responses you've gotten was driving the reason for asking for additional funding. So thank you
Yeah.
for that.
Of course, happy
Okay,
to provide that.
all right. Any other questions? Okay. With none, good to see you, Sue. And on that side of the screen, Andrea, thank you for being here, and we wish you well. Okay,
Great,
have a
thank you
good
so
day.
much.
All righty.
Appreciate
All
it.
right. Thank you. All righty. Jericho,
We are moving forward towards Nantucket Lighthouse School. We have one presenter in, and then we have also someone. I'm sorry, the representative from the Lighthouse School, I need to make your name your actual name. Sorry, for town meetings. Could you tell me what?
Sure, it's Emily Miller. I'll rename myself.
I gotcha. There you go.
okay,
Hello, friends. Thank you for having us today.
okay. Emily, would you like to start your presentation, please?
I think that I'm looking for Stephanie. Stephanie was going to start out for us since she's there with you, and then Susie and I are going to jump in if that's okay.
Okay, so please state your name before you speak. So who's ever in the room, I'm not sure I can see. So
Hi there, I'm Stephanie Sarah. I'm here with the Lighthouse School on behalf of the Educator Wellbeing Initiative. At Nantucket Lighthouse School, the mission is to cultivate social, emotional, and intellectual wisdom, and to foster childhood in such a way where each child experiences joy and meaningful impact within themselves, their peers, their families, and their community. As a parent at the Lighthouse School, I really feel the impact of each of the school's initiatives to engage not only the children, but the families and the community. You know, the families that Lighthouse serves, they help run this island, and seeing all of these initiatives being born from just fostering and cultivating additional well-being across the community year-round is really impactful to me. So when I wrote this grant, I wrote it from that perspective of seeing this program as another initiative that really has the capacity to positively impact and support educators on this island. The Educator Wellbeing Series is a collaborative program between Nantucket Lighthouse School and Mass Nantucket. I'm joined by Emily Miller, who's the head of Lighthouse School, and Susie Tapley, who's the founder and owner of Mass Nantucket. And this program, it's been designed to support educators' well-being by creating a gentle, peer-centered environment where breathwork and sound healing feel approachable and restorative, so that the individuals who participate in the program enter and feel as though they receive and then can go out and continue doing their really important work that impacts children, young adults, and adults of this island, sometimes directly and sometimes indirectly. I see it as a really important program, mostly because we are all spread so thin in this day and age, and the education of our children is something that we should be taking seriously across the board. And when we think about the people that are guiding them each day for 6 to 8, 9 hours a day, where is their mental health? Where is their well-being? And what are we offering them in exchange for all of the support and nurturing that they provide for our families and our community. And so this program is one that is at no cost to the educators. It is one that has morphed over the years to make it more accessible to all educators of the island. One of your questions in the agenda included, who benefits from this program, and that is our goal, to make sure that it's accessible to not only Lighthouse teachers, but new school teachers, public school teachers. We have a breakdown in our grant that includes, childhood education numbers as well. So we're nearing almost 400 educators on the island, which indirectly affects about 1,700 students. And so when you look at those numbers and you look at the manpower behind executing this program, it is a big feat, but it's something that we're committed to offering throughout the year for an 8-week program, which sort of is outlined in the budget proposal as well. And yeah, I hope that that's a well enough introduction for you guys. We were a little confused on the operating budget question, so we're happy to clarify that for you all. And I know that Susie has some really lovely things to share, and we can answer questions as you may need.
Okay.
Okay.
Joanna, is your hand up? No.
No.
Okay.
My
Okay.
hand's up, sorry.
Okay, Suzanne?
Yes, the question that I had on the operating budget was that the operating budget was for the whole school year. And I'm wondering about the operating budget just of the program for
No, thank you.
Yes,
Yeah.
so just for the program, we have a total budget of $108,058. Our total request is $100,000. That includes the weekly classes, monthly workshops at Mass, and then also a small administrative fee that requires us to do marketing outreach, the oversight of the program, the data collection, and the reporting. That does not include all of the development time. And also between, I believe, the first fiscal year where this program was supported, and now there was a gap year where those expenses were done predominantly through MAST, and taken care of predominantly through MAST, just so that there was not a gap in the offering for educators.
Okay.
Thank you.
Thank you.
Alrighty. So I think there's someone else. I don't see the screen at the moment, but someone
Susie?
from Mass.
Oh, yep.
Okay.
I'm happy. Good morning.
Good morning, Susie. Thank you.
Yes, so it's a pleasure to be here. So I was just asked to give a little context around the program. Members of the board of Lighthouse approached MAST last year, asking us if we would work in collaboration with them and apply for a grant from the town to address teacher burnout. And so we put together, using these science-backed modalities and really making it accessible to the teachers, did it at times for teachers. We found that when people come in their own community, they feel much more comfortable coming with each other. It was overwhelmingly successful. It was also overwhelmingly attended by the public school teachers. Over 90% of the teachers were public school teachers. So there had been a lot of discussion about elongating the program, about using it, about the school being able to use it as a retention tool for teachers. And the whole premise of the program is to give teachers and educators sustainable tools that can help regulate their nervous systems. Because as we all know, all of our teachers are dealing with things that go way beyond academics. And we had incredible self-reporting from those teachers. The other magical piece that I didn't think about and we didn't think about beforehand was that our beautiful island is very self-contained, and meaning that our educators are not going to neighboring towns to substitute. So every time we impact one educator's emotional body, and how really the goal is to use these tools to create a longer response time between whatever the chaos that's happening, the trigger that happens, and the way the teachers respond. And so, and we were successful in doing that with this group of educators who participated last year, so much so that they asked us to do, would we do it for the whole year instead of just the fall? So we formed focus groups over the summer, met with teachers at Lighthouse and the public school, and talked about what they wanted out of the program. They asked for an additional therapeutic component. They asked for a monthly like ceremonial circle type component where they could process some of the things that were coming up for them. And it was very clear that they wanted to be able to do it inside of their community of their peers, and to have that like confidentiality. The other piece that came up overwhelmingly was that the teachers who came from different schools, we also had a lot of early education teachers. That was a big number. So like our preschools on island, which makes sense because they're dealing with a lot of stimulation all day, that they really enjoyed. They don't have other opportunities to come together and meet their peers in that type of a setting. So that was pretty beautiful. I think so the town, made us aware of this granting opportunity, and we really came together to create this for the teachers. We're very flexible in shifting things around to fit everybody's need, because it is super important and it can be fluid. We can make adjustments and changes, but it was a really beautiful partnership between Lighthouse and MAST in the town. And we know you have so many incredible offerings and programs that are coming forth, and we'd be honored to be able to serve the community together in this way. It was really special, and our teachers, everyone on this island is impacted by an educator in some way, whether we know them directly or anecdotally. They're just pillars of our community, and we all know that they're in crisis, particularly in the public school. We've lost a lot of teachers already this year. So whatever we can do to help support that, we'd love to. So thank you for considering it.
Okay, thank you, Susie and Emily. I see Suzanne, you've got your hand up.
I do. I have two questions to Emily or Stephanie. What other fundraising sources are you pursuing? Is the first question.
For this program in particular, or
Yes.
in general?
Yeah, for what you're applying for.
This program really falls outside of our budget, and it is one that's why we're seeking grants for the program. As Susie said, it's something that we conceived of, but we conceived of it, for all people, all educators on Nantucket. It wasn't just for our teachers.
Right.
Having been in education for 32 years, I have seen what is happening in classrooms and what has happened post-COVID, and the degree of dysregulation, the amount of dysregulation, and how important it is to make sure teachers' nervous systems are regulated so that they can, support children when they're in those crisis moments. So this really does fall outside of our budget. It's not something that we're doing just for our school. We're doing it for all island educators. As a school, we already have to raise about $650,000 a year just to meet our operating budget. So we're, stretched very thin in that way. And so we're looking for grant funding for this program so that it can be available.
And I assume that if not granted the full amount, you would just scale the program to the funds that you have that we could give you if.
Yes, absolutely. Absolutely. And it really does come from an altruistic place of, just seeing what has been going on in education, particularly over the last 5 and 10 years. And, I grew up on the island, and if you lived in another community, you could, commute to your job. You might find more affordable housing, but it is very hard to live on Nantucket. It is very stressful for educators to live here, considering how much it costs to live on island. And we just thought if we could do something to keep people here, to support them in their emotional and mental health, that it was just one more thing that we could do to promote a healthy community in general for the island and for the children.
Okay. Thank you, Emily and Susie. Oh, Suzanne again?
Yeah, the second half of my question is, other than the grant application, do you have other specific fundraising plans or goals set for this program for the educator well-being?
We not necessarily, as I said, like our first priority is raising money to meet our
For the
operating
school.
budget.
Mhm.
And that's just to run the school.
Yeah, I could jump into that, Emily, because so we didn't, the last grant that we applied for was a different type of grant and there wasn't a waiting period. So we were, you know, in a learning curve. And we didn't realize that this would be available for next school year. So I personally just didn't want the teachers to be without something. I had spent the summer interviewing people. So we are running a donation-based program, but I'm underwriting it personally. Like and that's part of it too. So I own Mast. It's not a profitable business by any means. You know, it's a passion of mine. And so, but it's not sustainable for me to continue to fund it, but I wanted to fund it. So we made it donation based and teachers can give $10 or they can give whatever it is, but I'm paying my practitioners the full price because this is really important to the community and it's been an impact. So the relationship with Lighthouse was our catalyst and they brought it to us because of what they're seeing in their classrooms. And 100% we can scale it back. You know, we applied for what the teachers asked for, but we could run an 8-week program. We could run a 12-week program. We could run any length of it that we were awarded, but we would love to be able to make it sustainable. And for right now, this moment, I'm grateful that I'm able to finance it to a degree, but that probably helps give context to like where the program's coming from and how it's moving forward.
And I can briefly speak to it is that the town initially funded these wellness programs using a state grant that was out of cycle, so it could be drawn upon on the year in which it was requested. Whereas that grant funding has gone away, they're now on a fiscal year cycle for application.
Okay, thank you. All right. With no other questions, we appreciate your time today and best of luck and have a wonderful day.
Thank you all very
Okay.
much.
Very good.
We'll be coming
All
back.
right.
Okay.
All right. Jericho,
Yes, we have Victoria Croswell for New Hope, who is on the screen here.
all right.
Hi there.
Thank you. Victoria, you've got the floor.
Oh, great.
Okay,
Nice to meet everyone. I'm Victoria. I own Hope on Ack, also known as New Hope, in my Connecticut offices. So as you've probably all read by now, I have 2 program initiatives, pilot programs that I'm interested in facilitating on island. One involves middle schoolers, specifically those that have emotional regulation issues. These would not be clients that necessarily are on the spectrum or anything like that, but more have experienced some form of trauma or emotional needs that are higher than the community can serve right now. And then the other population that the program that we're looking to host is in fact for substance misuse, and that would be for 18 years old up. And for both programs, we're going to be focusing a concentration on lens neural feedback. For those that aren't familiar, it's a form of biofeedback. It is a equipment and tool that is used to help regulate the nervous system. So what it does is think of as I'm sure you're familiar with an EKG. This is taking an EEG, which is your brainwaves. So we take in your brainwaves, we pick a certain setting for you that we think would benefit you and the targeted needs, and also how we guess on the first time how your physiological makeup will respond. Sometimes we can get it on the right mark, and then sometimes we have to adjust for the next session. because we obviously want to see a greater impact. The reason I chose those particular population is, one, on a personal level, I used to work at NIS as a school social worker, specifically working with the options program and similar like-minded children or similar need children. Sorry, my charger just came undone. And it's always been prevalent, right? And I think we're all aware of the substance misuse on the island and how that impacts our children. So, and how that impacts our community and kind of how the need is there. As you know, middle schoolers, right, you still have the opportunity to work, right? Like the whole goal is to work on this regulation now, so that way we can provide the psychoeducation, we can provide the clinical expertise. We'll have a behavioral analysis coming in each week as well, helping them work on specific targeted areas with the behavior they're demonstrating at home or in the community. So like getting school reports, getting parent involvement. These referrals would be coming from hopefully the school, families. They would be all low income or all, sorry, I should clarify. The program would be free for everyone, both programs. That's the whole point of applying for this grant, is to make it accessible for literally everyone. You don't have to have insurance. You don't have to have any funding to complete this. As you know, off island, there's a lot more resources like intensive outpatient programs. We don't have that here. So this is a very targeted pilot program, I should say 2 pilot programs. 10 weeks is for the substance misuse one, and 12 weeks is for the middle school program. We have not run this program before. I think that was a question that was brought up. However, other people have. So if you've referenced at all the proposal that I wrote, there's a lot of research in there. If you look at in 2005, written by Scott, you will see that they did a program utilizing LENS specifically with those with substance misuse issues. What they saw over the 12 weeks, months, is that not only was there higher abstinence completely from any substance use after the treatment, but long-term, right? They didn't need it for 12 months afterwards. We see in the Canon one and done in 2019 that it reduced cravings and they were able to better regulate. Oaks Labs themselves, which is the creator of this LENS neurofeedback equipment, we see 2 studies in there that basically say overall reduction of anxiety, trauma response, depression, PTSD symptoms, flashbacks, all of that. And then one of my favorite ones done in 1991 is the Pennington one and Koloski, where it was dramatically reduced the alcohol and cocaine dependence, which, as you know, on here, I think is pretty prevalent. What else can I answer for you? The populations that we chose, both populations are high needs here. According to the survey done by the Nantucket Cottage Hospital, these are 2 groups that really would benefit from resources on this island. What else can I tell you? It would be licensed providers coming in, doing the services. So the middle school program, we're utilizing a behavioral analysis who's local to the island and works with our children already on the island in the school system. And then myself, who also is familiar with the school system and working with students in this population. And then we would be working with a local teacher whose her primary focus is doing that trauma work of expressive arts. And again, this is in tandem with utilizing equipment such as LENS neurofeedback. So that approach, we're really trying to look at it from a behavior standpoint, a clinical standpoint, and giving them the tools to be sustainable in their environment. Again, we can never change someone's environment. What we can do is give them the tools to access their strengths, right? Or access resources in the community. I believe a question came up about interpretive services. That is our goal as well. Should we have any clientele or members that do not have English as a first language? We are hoping to build formal collaborations with places that already have interpretives services, such as like Safe Place or the Nantucket Resource, Family Resource Center. And if that doesn't work out, we've discussed also utilizing members of our community who are well versed in both languages. And if that doesn't work out, there's assistive technology that we're also willing to fund on our own, which is, I'm not sure if anyone's familiar, but there are AirPods that just came out that can interpret it real time. So you can put them, I'm wearing some right now in my ears. These are not the new ones, but you put them in, I'm talking to you, it immediately translates what I'm saying. And then I'm holding the phone, and they're holding the phone so they can communicate back. So we do have a plan in place for that as well. I don't think the program would be successful without having that obviously in place. What else?
I have a question.
Yes,
Sure.
Joanne?
Yes. Hi, Joanne.
Hi, I'm just curious, how many people can you serve?
Yes. Sorry. So we're ideally hoping to serve 15 middle schoolers and 15 substance misuse. If we can get 15 to 20, amazing. Because again, we believe that this is a very valuable program.
Okay. Linda, I see your hand up.
Thank you, Madam Chair. A couple of things. So this truly is a startup. And
So
Here.
not the business itself, but the program itself. Yes.
Yeah.
Yes, ma'am.
And have you started to establish relationships with Safe Place, Family Resource Center, the school in particular? Or is that
Yes.
as a result of our funding this?
So kind of both. I can say that I've spoken to Safe Place and I've been able to have a meeting with them, not specifically about this, but introducing myself as Hope on Ag, demonstrating the lens equipment on them. Specifically, the school, to be transparent, is I think will be difficult, but not because I work there. So I'm hopeful that it might, bridge the gap a little bit. And again, we actually have the previous school social worker who used to work in the middle school now work for us full time. Her name is Nicole Sandoval. She works for me full time. She'll be part of the program. She's still in active communication with the middle school frequently. She just was there last year. So we're hoping that we can bridge that. Beth Hallett, this is TMI. We used to work with my mom in Quincy. So I'm hoping that it won't be too challenging to get some contact with the school. This is actually being sponsored already. Not sponsored. Sorry, what is the word? I guess sponsored, because I am not a 504C right now. I've reached out to Fairwinds, so I'm hoping to get in contact with them. Obviously, I'm going to be reaching out to Addiction Solutions. I have sent many inquiries. I think it's going to require me to go in person for that.
The Community Foundation would be someplace to go also as a startup.
Oh, awesome.
And they can help you with the 501c3 filing.
Oh, amazing. Okay.
So go to the Community Foundation, but are you going to have an office?
Are you
somewhere?
talking about Community Solutions? Because that's who's actually sponsoring me.
No, the Community Foundation.
Community Foundation's a different
Okay.
thing, but let me finish when I have a couple more questions. Are you going to have an
Yes, ma'am.
office or a place to go?
Oh, yes. So,
school?
yes, I'm so sorry. Summer Street Church actually has office space that I'm in right now on 4 Trotters Lane. They are donating the space for both programs as well. So
And
there's
they're
a
building well. And
Yes.
these programs are a set amount of time with these families.
yes.
Having had 5 foster kids, when
Mhm.
with these families, the problems are ongoing.
Mhm.
When you're done with the session, the 12-week, whatever it is, are
Mhm.
you going to be able to do follow-up as part of your program?
Yes, and we're hoping it to be a success where we can reapply for a similar grant, whether it's through here or somewhere else, to continue implementing it. We're
I'm
really
talking
hopeful that.
when the kids have gone through the program, are you going to follow up on these kids?
Oh, sorry.
after
So
the
we're
program?
actually having parent sessions. So part of the curriculum that we're designing is actually doing parent involvement. So it's not just your child comes and, you know, we don't have any collaboration. They should be getting behavior interventions. We should be working kind of on treatment planning and then collaboration. So parents will be required or highly suggested to come in to our parent sessions. Yes.
Because next year when you apply, one of the things is, especially if they run for the year, we're going to want to
Yes.
know the success rate or retention
Yes.
rate, or, you know, how
Mhm.
effective was the program for next year? Because
Yes.
that'll give us a lot more information, because right now it truly is a pilot program here.
Yes, and I'm not sure if you have access, like who has access to the proposal or not, but included in there is our outcome measures, which would be, we were looking for an 80% completion rate on both ones. We're going to be using a PSS-10, which is a stress reduction scale that we're going to do pre and post, obviously. We're going to look
Great.
at a 30% reduction rate of cravings, and we're going to use another type of form, which is an RSEQ, which is those are specifically for the substance user, and we're going to look for 50% increase in coping confidence. And then overall, we're going to do a satisfaction survey, and we're looking for at least 85%. So we did include measurable goals, because obviously, how can we aim success without having some type of incremental measurement? So yes, absolutely.
This is a fantastic program, having had 8 kids in that school go through that middle school.
Wow.
That,
Yeah.
it's tough. Middle school is Armageddon, basically.
Yes, yes. And that's kind of why we're hopeful that, you know, let's get them before they go to high school, right? And we need to make sure they have the schools to be able to handle their emotional regulation, to handle the fact that they're having these potentially trauma responses or learning disabilities like ADHD. So that way, when they're in high school, they're not just going straight for self medication, you know, or going down that route.
Or stress in 9th grade. That's a terrible transition.
Yes, I know. And then
Um,
just as a side note, thanks for all your fostering. It sounds like you've had your hands full. There's not a lot of people that have the capability to do that. So well done.
Well, they need
And-
more people here to do that, frankly. You're going to run into kids
Yeah.
that really need to be placed,
I
and there
know.
aren't any
I
houses
know.
here.
I know. I remember a family I worked with on the school that we had to send off, and it was traumatic for me. But
Very
I lived in
traumatic.
town housing. Yeah. Yeah.
Victoria, thank you for the explanation and, you know, being new program. And I think what we've seen, and you gave us a good explanation, is the outreach and to build the confidence and comfort, because you need the support of the family, particularly with those.
Yes.
It's not just the student, but it's the family.
Mhm.
So thank you
Mhm.
for that explanation.
Yes.
Because, you know, I think it sounds like a fantastic
Mhm.
vehicle. And but getting the people to come to you is
Yes.
key.
Yeah.
Yeah.
You can you know you can build, you know, the field of dreams, but you need to get the people.
Yes.
So, and the also as Linda said, the data, the follow-up to see a result on the program is extremely important. And I think that because of your professional background, you understand that. So the pre and the
Yes,
post
absolutely.
is extremely important. So thank you. Thank you.
Yes, thank you.
I just have
Any-
to add, Veronica, this is one of the
Yes.
more well thought out specific programs we've seen. I mean,
Yes.
Oh, thank
absolutely
you. Yes.
well thought out and well presented, I have to say, out of all the 20 or so that we see every year. This is
Well,
very
thank
well
you.
presented.
Thank
Right,
you.
and-
I will say that I think it's on a personal level, again, it wasn't arbitrary. I've lived here. I moved back here. My heart is here. I know the community. I know the needs. It's a unique culture, and one that, you know, needs support. And I, you know, reference, you know, years back, those incidences with the suicides and all that stuff. Like, it just, you know, there needs to be more preventative care. And if I can assist in that at all, and hoping I can be at all tool, great, let's do it.
Thank you, Victoria. And
Thank you so
again,
much, everyone.
Well done application. Thank you.
Thank you so much.
Questions, you have a wonderful day, and we
Thank
will
you.
move on. So thank you.
Thank you.
I believe we have small friends on deck.
Yes, hi, this is Jeff Coakley. My name is not Catherine.
Okay.
I'll sort that out for you.
And Heidi's here too.
All right. Okay, Jeff and Heidi, if you would like to begin and a presentation, we are ready for you.
Go ahead, Jeff.
Yeah, so our grant application delves upon the bridging the tuition gap that that we face each year, which in total it amounts to about $90,000, and that tuition gap is the money, the unrealized income that we don't receive because we offer subsidies to our teachers who have children in our facility, in our center. We also offer, to make it more affordable island-wide for our parents, working parents who have multiple children in the school, we offer a subsidy for siblings, in that siblings get a 25% discount off of the full tuition rate. And the teachers, Heidi, is it 50% discount for teachers?
Yep.
Yeah. So in an effort to make it more affordable across the island for all families that have children here, and to retain teachers and to attract teachers, we do offer this. But it comes at a cost, or at least not revenue that we would have if we didn't offer this. So we are requesting $60,000 from the town to help offset that $90,000 loss in revenue.
Okay. Heidi, do you have more to add to that?
No, that's pretty much why we have currently 4 teachers that have students here at Small Friends at a half off price tag. And we also have 7 families with multiple children, 1 with 3. So we do offer that 25% off to the oldest children in that family off of their tuition, just so that they can at least try to make it a little bit more affordable for them. So yeah, Jeff did a great job explaining that. We also have a very high, our payroll is very high. Our ratios are very different from that of, you would see at the public school or any of the private schools. We are licensed and governed by the Massachusetts Early Childhood. We have licensure through them, and our ratios in a classroom. So if you take our smallest classroom of 7 infants, you need 2 teachers or 3 teachers for 7 infants. That's something you can't get around. It's licensing, it's safety. And we certainly take that. That's my main priority here. And even in a toddler room, you can't have 1 teacher for 9 toddlers. You have to have 2 teachers for 9 toddlers. So that it makes us kind of heavy on our payroll. And with that, $90,000 is a huge, right off the top. Every, January, we know that that's coming. And we also take state vouchers here for our students. So we do incur some discount for that. So yes, we run at a negative right off the top in January.
I think it's important to know too that we are open year round, so that during the summer, our parents don't need to scramble and try to figure out their double work schedules or try to find a camp for their children. We're here for them.
Right.
So. And
we don't charge a camp price. We're the same year round. We keep it the same. The parents are the same. This is for working parents. So we don't unenroll in the summer months to enroll children, that are coming for the summer. These are all of our year round town workers, children, nurses. We have EMS here. We have firemen here, police officers, children. These are all the children from the town that we take care of.
Right. So some of the essential services that we all rely upon, whether, it's an EMT or, I don't know, a landscaper. These are our parents. These are the parents of our children, and that's a community-based need for all of us. And so the fact that we can allow both parents to work, which they need to do in order to live on the island, is good for the island as a whole.
Exactly. It's a vital service. This is Veronica, and in the past, we have funded basically the summer program. So this is a different application than we've had in the past. How have you covered this cost in the past? Because as you said, January rolls around and you've got this deficit. So how have you been funding this?
So we haven't been this heavy in teacher staff ratio. Usually we have 1, maybe 2, but we currently have 4, and we're also we are keeping them at a small rate so that they'll stay. And then when they're here, some of them have degrees and some of them are working towards their degrees. So we are heavy. I'm a huge plug for professional development. We are getting all of them. All of them are actually licensed now. But it took 9 months to get them all licensed. They're all licensed now. They're all continuing their education. They have children in the center, and when they didn't have the like a degree, now they're working towards their degree. So I'm glad we have 4 staff members here, and 4 staff members that are setting such a wonderful example for their own children. And I'm hopeful that we have more, but it does come to a cost to Small Friends overall.
Joanna, I see your hand up.
Yeah, so I just have some questions about the financial piece of this. So if you're asking for $60,000 and you're serving, you said 7 families that you're giving a tuition discount to, and 4 teachers who you are doing the after school to, right?
Yes.
So if you divide the 60,000 by 12 months, that's $5,000 a month, right? So if you divide the $5,000 by your 11 people that you're assisting, right? That is like $450 per person. So I'm just maybe suggesting that there might be a different way to look at how you recoup this money, because that's a high cost per person, right?
Yes. Yes.
So in order to really understand that formula, like you'd really have to break it out for us in terms of like, what is the number that you are offsetting per student or per family, so that we can kind of map that back to the 60K ask.
Okay.
Does that make sense?
Yes, completely. Yes. Okay. So you would like to see perhaps what our tuition is versus what the 25% is that we give to our students per week.
Right. So what I want
to our staff members.
Right. What I want to understand is, what is the offset? So if you have 4 teachers who you're paying for the after school care for their kids, what is that cost?
And
all right, so
you can do the calculation and we can send it out and make sure that it's done before.
Yeah.
Like there's no need to be doing too much math in the middle of
You don't have to do it right now, right?
I can give you those formulas. I can send you guys an Excel sheet if you need.
That would be helpful.
Sure.
The calculator, and I figured we'd just.
I just wanted to do one for you. So if you take our tuition per week, let's just say for the minnow classroom, which is our babies, it's $472 per week for parents.
Okay.
But we only charge $169.50 for our staff. So that price minus the 472 minus the 169. That is what we're losing per week in tuition that we could be giving to somebody else that was on our wait list. And that's what we're losing per week. That's how we came up with that calculation. So I can do that per staff member through Excel, and you could see it per staff member because they're all in different rooms. So we have different prices for different rooms. So I want to make sure it's accurate. I can't just do it off of the Minnow classroom, but I can definitely get you the room breakdown, the cost of the rooms breakdown, and the cost to us with staff member discount and sibling discount, because they're all throughout the center. So I'd have to.
Right. That would be helpful because
Sure.
it isn't just a straight division of the across the board. Linda, I see your hand up.
We have, you guys are doing a great job, but we've had various applications over the last several years for different things. And didn't we do the snack thing one time, and we did, I think, the playground one time, handicap accessible and stuff like that. We've done different things. Those programs are still ongoing, but without our support, correct?
Correct.
Okay, that was one thing. During pandemic, even maybe before you took over, they couldn't go to full staff because the teachers weren't coming because of the pandemic, et cetera, et cetera. That started just before the pandemic. And you couldn't go to full strength. You had to, because obviously because of the student to teacher ratio. Are you now, you have a certain capacity limit by law, but are you now up to capacity with the waiting list still?
Oh, right.
Still not.
I'm sorry, no. Thanks.
So we are licensed for 69 students, and we
Right.
currently have 45 students. The reason for that is we still have a classroom that is not in use. And the reason for that, again, is because we do not have teachers to staff that classroom. Again, which is why we love it when parents come as teachers. But we don't have the staff to open that classroom safely. And so we have a whole classroom and a huge wait list, Linda, that I would love. I mean, and everything comes down, really, everything comes down to housing. So that's kind of our strategic plan is in the works for that. But that's one of our biggest problems is teacher retention and teacher having them in. What you were speaking of before the pandemic, we had two workforces, one that would come in at 9 and stay till 5:15, and one that came in the morning and stayed till 3:30. And when we opened after the pandemic, we lost 10 teachers. Right, for that. And because of that, we weren't able to have, with our ratios, we couldn't have that split staff. And we still can't have that split staff. Even with our first priority would be to open that classroom before we had a split staff. So we can't open till 5:15, which is unfortunate. But we're doing the best we can with the hours that we have. And getting more teachers is one of our biggest priorities right now.
Have you talked to, just to throw that out there, the school to work thing? Have you talked to the high school about kids that are graduating that might want to go in this direction? And maybe could they have living space here?
I haven't, but we do, again, we do have a couple of graduates here now that are able, again, through the ECE grant. They take their first course and we provide the funding for that through some of our grants for professional development. And then they take that first course, see if they like it, and then hopefully they want to go a little bit further. And the ECE has a grant from Massachusetts that provides money enough, a grant enough for them to go through and get their all the way up to their master's degrees. So we have 4 teachers right now doing just that, which is great, and 2 that were high school graduates. So it's a great program if I can get people in to start that. And then, if we have graduates that don't have college in their future, but really would like to go, this is a doorway in.
That would increase, if you get those kids, that would increase the ability to go to your full max. Because you haven't been at full max in a long time because of the teacher retention problem.
5 years.
Yeah.
Yeah.
Thank you.
Okay,
You're doing the best you can with what you have.
exactly.
Yes, thank you, Linda.
Yes, thanks.
Okay, Lee, I saw your hand up. Do you have any questions?
No,
or-
it was covered with the financials. I was just looking for, I think you guys are gonna do it, but I was looking for a breakdown on the tuition costs by student, if you can do that. I know in your application, you just kind of had an aggregate cost there. So I think you're gonna cover it when you know, get the other stuff to us.
Absolutely.
Right. With no other questions, thank you for your application and your explanation. Very helpful. So, best wishes and have a great day. And we look forward to getting that information. And if you could provide that in by early next week, that would be very helpful.
Excellent.
Sure.
Will
Thank
do.
you for,
Thank you
thank
so
you for
much.
your-
I appreciate you.
Thank
yeah,
you.
thank you for your
Thank
consideration.
you.
Thank you.
All right.
I have,
Okay.
I have health imperatives I've racked up is probably slightly less, nice phrasing than I could have done, but, we have, Elizabeth Torrent, one more admitting. Elizabeth Torrent, Jessica Cisternelli, and
Julia?
Yes, hi.
Nick.
Hi, everyone. How are you?
Okay, good to see you.
Good to
Julia,
see you
have the
too.
floor.
All right, I'm going to turn over the details of our proposals to Elizabeth and Jess, but I just wanted to thank you all so much for your support over time and give you an update on what's been happening with us. As we've talked at the celebration, Health Imperatives was defunded from billing Medicaid by the federal government. The Massachusetts legislature is in process of coming up with funds to help us. But overall, we're very concerned about the ongoing orchestrated assault by the federal government on the people we serve and the programs we run. Having said that, we also already structurally have some challenges in the way we're funded, where most state contracts are not adjusted for inflation, despite the skyrocketing cost of living. And as you know, other municipalities and foundations have gotten more and more applications, and so there's often less money available to us. So we've been doing everything we can to aggressively seek alternate funding sources, which is individual foundations and corporations. And we just learned this week that we did receive one of 80 grants from Melinda Gates Pivotal Philanthropy in the world for $2.5 million, which will definitely take the edge off and allow us to be a little more flexible when we get the next hit, which we're expecting soon. All this to be said, it's more important than ever that we raise money so that we can have an active presence on Nantucket. And you've been our best municipal partner everywhere, and you're a example to all. And we really appreciate it. And we're doing everything we can to not only serve the people we're currently serving, but be ready to serve more, because we know that the actions this government is taking is creating a new and a worse need. So thank you. And I'll turn it over to Elizabeth.
Thank you.
Hi, good morning, everyone. Thanks for having us. I'm going to talk a little bit about the Nantucket Health Equity Now. We obviously put a lot of details into the grant, so I'm happy to answer questions. But as many of you know, we have multiple programs on Nantucket. The two biggest ones are Sexual and Reproductive Health Service, which has a huge gamut of services, which is in the proposal, but I'm happy to go over if people want to hear more. And the WIC program, serving anyone eligible for WIC. What they have in common is that we're serving a common population, and Nantucketers, like the rest of Massachusetts and the country, are struggling, and these programs really are focusing on people who might not otherwise have services. They don't have insurance, they may be undocumented, they may speak another language and have barriers. 75% are uninsured, and virtually all are very low income and struggling with food insecurity and access to health care. So our goal is to see everyone, anyone, all genders, all languages. If people don't speak a language that we have on staff, which we have, Spanish and English, Portuguese, we have interpreters. So there's our issue, our focus is no barriers to get people in, get them health care, get them support, get them services as quickly as possible. and refer them if things are out of scope and we have, we prioritize partnerships in Nantucket. As you can read, we have lots of inroads and collaborations that we wouldn't be able to do it without all the partners. So that's part of our grant. So I'll hope that summarizes it quickly. And Jess is going to talk about the substance use.
Yeah.
Thank
Hi,
you.
everyone. Thank you so much for considering our application. The substance misuse grant, we hope will continue to support our harm reduction program on island, including Narcan, overdose education, other fentanyl and xylazine test strips so that people are more informed about the drugs they're using and how to stay as safe as possible while using drugs if they're not quite ready for treatment. We also hope that those interactions with folks who are using drugs on island will consider entering treatment, whether it's with us or with our partners on island, Dr. Lepre and ASAP. And so really hoping to just use this money to help continue to support the program, grow it, reach more people on island, and help try to break down some of the stigma that's associated with using substances. And sort of normalize it, that this is stuff that happens even on Nantucket, and how can we help people to stay safe and make healthy choices as best as possible while using substances. And so this grant will help us and support us to continue to do that. And I just wanted to highlight too, that despite all of our funding challenges and staffing challenges and all of the things, that we haven't had to reduce services anywhere. And so everything is still available as it was pre-Big Beautiful Bill, pre this Trump administration. And, Julia and our teams are just working really hard to keep us viable, because we really truly believe that our services are vital to the communities we serve, especially those islands where you're physically, geographically isolated. It's not, you can't just run up the street to somewhere. So we're really committed to ensuring that folks have access and have trauma-informed, culturally informed care in the communities where they live. So thank you.
Thank you. Questions from the committee?
We're talking fast. We are.
All right. I don't see any hands up, but I know one of the questions, and we've looked at this with other applications too. When we look at your board, you don't currently have a Nantucket resident on your board, and we know that you are dedicated to serving our island, and we appreciate that. But we hope that you would consider seeking out to have a representative from Nantucket that maybe could help support our unique needs. And Lee, I see your hand up.
Oh, can I just respond to that? Sorry.
Yes.
Not only will we do that, we've been doing that. And so we are really committed to it and appreciate any recommendations of people you think might be interested. It's a lot easier now, I think, to recruit people because we're going to do most of our meetings, if not all, on Zoom. Whereas before, when we had representatives from Nantucket, it was difficult for them to get to the meetings. So any suggestions you have would be great. And we'll keep on it. Thank you.
Thank you, Julia. All right, Lee?
Yeah, Julia and Jessica, thanks for the application. Just a quick question. We've asked other applicants because same question you brought up, which is the state or federal cuts. Do you guys have a sense as to what's actual versus what's anticipated?
Yeah, so the first cut that we received was an estimate based on revenues that we would lose, and that was about 1.4 million through June, 1.8 million through September. That's the money the state's making available for us. The other big potential cut is a federal grant that covers the clinics, and that is 1.3 million a year. We already have half of the money for this year, so if anything, we could lose another 600,000, 650. The big unknown is the WIC program. Given the government shutdown and a lot of the action that's been happening, we don't know anything in particular, but it's definitely a concern. And of course, the larger concern is that the state is having to fill gaps for so many programs that they might not be able to continue if we're defunded again next year to keep making up that money. So that's why we're trying to get ahead of it. So, but you're right. It's a lot of it's anticipated, and every day it's a different thing. And that's why we call it like death by a thousand cuts. But so far, so good.
Okay, thank you for that.
And just to clarify, the numbers that you threw out, that is for Health Imperatives as a whole organization. That's just
Yes.
not for
Yes.
Nantucket.
Yes, exactly. But it's important to note
Yes.
that whatever happens to Health Imperatives, it affects all of the communities, because we do leverage a lot of our resources to support each community.
Exactly. All right. Joanna?
Sure. Hi, thank you. Just a couple of questions about I think the budget piece of this, because the way that you guys have traditionally approached grants with us is to support these programs, right? And when you look at, and one of the changes that we've made this year is the difference between operational funding and program funding. So I just want to make sure that you understand that if you are applying for program funds, then our sort of expectation is that you're running the programs and the funds we're giving you go to the programs, right? So they can't
They always do, yeah.
Yeah, well, I'm just making a distinction because the other option is always to apply for the reason I'm bringing this up, I'll tell you in a second, is so that you can apply for operational funding, and that can go directly to offset your payroll costs, right? Or grants that you might not get. And so I worry, after listening to you talk about this, that you might not need this money in other areas that could potentially be cut. And I would just kind of urge you to think about that.
So if I may, it's very difficult for an organization like ours to apply to you for general operating, because that would make it impossible to show that it's for Nantucket. So our only option in this application was to go for program. So for us, when we say operation or programmatic, the money is still going to cover operating costs for those programs on Nantucket.
I see. That's interesting. Okay.
Right.
Thank you.
Okay, yes, because we were, question we assumed that you would do a operational grant or a capacity grant, but that does explain why. So maybe we can have some further conversation at a later date, you know, on.
Yeah, and the capacity would be if we were to grow capacity, but this is really to cover the cost of what it takes to run the programs on Nantucket. So we could call it operational, but like I said, when we normally apply for an operating grant, it's for the whole agency.
I think that in your case, if you identified a Nantucket-driven cost for your operation, that might be a way to approach this, right?
Maybe we can talk offline, because I don't quite understand it, because we are covering our costs. There aren't different costs that we didn't ask for, so I'm a little confused.
Yeah, I think we should do that.
Okay.
All righty. Thank you. Any other questions for Health Imperatives? All right. With none, we thank you for your application, and we thank you for the vital services that you provide for our island. And have a wonderful day. Thank you.
You too.
Thanks,
Thank you so
everyone.
much.
Congratulations
Thank
on the
you.
Linda Gates Foundation. Great work on that.
Yep.
Thank you so much.
Thank you.
Bye.
Good. All right. Who do we have next?
We have Fairwinds.
All right.
I believe Roberto and Rachel are here.
Good morning.
Is Christy here? Let me check I think it might be the program.
Christy's not going to be able to be here.
Okay.
All right. Good morning, Roberto. You've got the floor. Thank you.
No, we just wanted to say thank you for having us here today. We submitted the application so that you can help us with our cybersecurity funding and our really our IT infrastructure rebuild. If you remember about last year, I've been here for about a year and a half now, just under a year and a half. We started with a financial audit and a financial and management overhaul of Fairwinds, which we are in the process of completing. And now with the next stage of the iteration of creating turning Fairwinds into the organization that the island deserves, we are asking for some funding to continue with our operational and technological infrastructure migration. So what that means is we have retained ACS, which is a third-party IT services firm, full service. So they are actually in the process of looking to implement some of our new virtual environment. We're migrating away from Google to Microsoft. In a nutshell, I'll leave it there.
Okay. Do we have questions from the committee?
I mean, Roberto, I think it's probably the same question I just had for health imperatives, right? Which is, I'm not sure why this is not an operational grant. And
Oh,
go
I
ahead.
believe this
No,
one.
It is.
This is.
Yes, this is.
Yeah, I was about to say that it was my interpretation
Yes.
of the
All
operational.
right, maybe I've just read something wrong, so I apologize.
Okay. Yeah, no, this one is. Thank you. If you give me 1 second, I did have a question because I know that our cap on grants that we are awarding this year is 100,000, and I think that what you're gonna do, there is a gap, so that $49,000, I believe. So how is that going to be funded?
So what we are so the original work that we're doing, the managed IT services is, we actually have the budget breakdown in the application. The actual managed IT services is $97,200. The cybersecurity stack is what is that extra section. The cybersecurity, when I found out that we were capping at 100 this year, Jericho did let me know about that. I started working with some of our board and our other funders to see if we can alter one of our donation one of the grants that we were given to cover the rest for this cost. Because it is a capital outlay, that cybersecurity stack is a capital outlay. It is a one-time fee. So we are potentially going to be able to cover that in full with this one donation. We don't have the donation in hand, but we do have a verbal commitment so far for the extra 49,000.
Okay, so you would be able to do the entire thing with additional funding then?
Correct.
Right. Okay.
We have a
Perfect.
very generous donor who agreed verbally to cover it.
Good. Well, wonderful. Other questions from the committee? All right, I don't see any other hands. Well done application. Explanation was pretty thorough, so thank you very much. And we appreciate your time today. All right.
Thank you. I really appreciate that. I expected
Okay.
6-7 questions.
Well,
Thanks, everyone.
Thank you.
Thank you all
right.
so much. Have a great
Good.
day.
Good.
Bye-bye.
All right. And Jericho, I'm just, saying we do have other questions for them, but it was not on the application, so we did not want to go into that. So that's, I think he may have been expecting, more, but we're here today just to talk about the application in front of us. Right.
And I will follow up with him around the reporting question that came up.
Great. Okay. Thank you. All right. So next we have, is it VNA?
Yes, should be the Visiting Nurse Association. We have Beth Howard, and I believe there's Meg Pan.
See Meg. Okay.
Yes.
All righty. So Visited Nurses, Cape Cod Healthcare, you have the floor.
Thank you for inviting us here today. We did submit an application for $75,000. So the Visiting Nurse Association of Cape Cod, we are part of the Cape Cod healthcare system. However, we are our own entity, and even further down VNA. So VNA is made up of home care, hospice, and we have our public health division. So today I'm here, Meg Payne, Director of Public Health, speaking on behalf of our public health division, whose entity is even more, we have our own budget and walls to work within. So a little history, we have been contracted with the Nantucket Health Department since 2023. Our contract started off as a maternal child health service to the town, and then has evolved and grown. However, our budget has not, and I think that that's a trickle down effect from what I understand from, outside sources. We have a wonderful relationship with the town and with our community partners. There's a lot of potential for this program to grow and expand and serve as a safety net. We're just lacking the funds. So what we provide as a public health service contracted with the health department, we have a town nurse, and I just want to say all of our staff live and work on the island. Our supervisor, Kelsey Gray, is out on maternity leave, so she's not here to join us right now, but she's really the powerhouse and the leader on the island. So we have our town nurse program, and this program is meant to serve people who do not qualify for traditional home care. A lot of who we see are people who have an insurance that doesn't cover a home care benefit, such as Mass Health Limited. That's a lot of the non-English speaking communities that we're seeing. So they might have a medical need, however, they don't qualify because of their insurance, or sometimes it's another reason, they don't have a skilled nursing need, things of that nature to qualify them for like traditional VNA home care. So that's when our public health nurse can step in and those visits are funded by the town. It's not driven by insurance, which is beautiful, because I'm not sure what you know of home care. But basically when somebody comes to us with a diagnosis, we put it in the system and the system spits out this algorithm based on the insurance saying you can only see this person this many times, this is the frequency, and then you have to be out. And it really kind of takes away from what the clinician is seeing firsthand. But with our public health service, we really can spend time with people. And it's all about education and connection to existing community resources. The goal is to keep people in their homes safely, and also to have them connected to resources to help them stay in their homes safely. So our public health nurses, the town nurse, will do home safety evaluations and recommendations. They do medication review, again, lots of education. We assist with file of life, MOLST forms. We can assist with telehealth appointments if people are struggling with, have a hard time getting out of the home, but they're struggling with technology. Our clinician can sit with the individual and do those calls with the provider. We do a lot of home oxygen education, setting up lifelines. Transportation is huge. And also by having a nurse go to the home, that is decreasing barriers such as transportation, if that's an issue for folks. We do the basic, we check vital signs, communicate back and forth with provider offices. If there needs to be an adjustment with medications, or if we need to notify them of something new that's happened, we have that back and forth communication with providers. In addition to our town nurse service, we do have a really robust, and I mentioned this earlier, maternal child health service. Our nurses are certified lactation counselors. We work very closely with Nantucket Cottage Hospital, with the OB providers, the pediatricians, and the maternity unit. We see mothers and babies prenatally and postpartum. All of our materials are translated. We do see a large Spanish-speaking population on the island, so all of the materials that we provide are translated in their native languages. Our nurses also just completed a 4-week education on bereavement training for the perinatal population with an organization called Star Legacy. So we like to be prepared with whatever it is that we see. And unfortunately, we do see some need for bereavement support. And we also partner, one of our community partners on the island, Sharing Kindness. We have a perinatal loss support group that we partner with them on for folks in need of support around loss. So we will see mothers, birthing families prenatally and also postpartum. So our nurses bring our baby scales, we can weigh the babies, we communicate back and forth with the provider offices. Many times, you know, preventing, I don't know, I'm blanking on the word, preventing the family from going to another pediatrician appointment. You know, we can communicate back and forth with the pediatrician office, like, yes, baby's gaining weight appropriately, color looks great. Maybe they don't need to attend their appointment tomorrow, kind of a thing. So we work really closely with them. Again, everything's translated into native languages. So in addition to town nurse, maternal child health, we also have a large vaccine program, and that's something that we've really felt a hit with this year. And something that we really would like more support with. So we do provide flu and COVID vaccines. We have in the past provided large community clinics, and then we also provide homebound vaccines for an individual who has a difficult time getting out of the home. Could be for mobility reasons, could be for mental health reasons, and also their caregivers. Whatever support system is in the home too, we will also vaccinate them if they wish. So that's something else that we're seeking support with. And I think historically, and Jericho can correct me if I'm wrong, I think that the town of Nantucket has historically leaned on the state for their mobile vaccine unit service. And unfortunately this year, they cut that service. So that was not an option this year, and we felt it in many of our rural communities. They were lacking that support. So that's something, that's a place where we would like to work with the town and support in that area. Another area, another thing that we provide and that we would like to work with the town and maybe build upon what's being done already is that we offer communicable disease surveillance and follow-up with the state. We recently hired an epidemiologist who works with us and is familiar with the islands. And there's a lot of opportunity to work together and collect data and identify patterns and really try and be proactive when it comes to disease management. So it would be, I think it would be really neat to work with the town and try and spearhead some of that with, you know, foodborne, tick-borne, respiratory virus. I mean, the list goes on and on. But TB surveillance, that's something that we also provide. So I don't know if that was a small snapshot. I could go on and on. That's kind of, that encapsulates what we're looking to for this funding to support and in order to better support our town contract and our relationship with the health department.
Questions from the committee? All right. I think that you pretty well covered everything. So thank you for that full explanation. Being the first time that you're applying to this committee, we did want to just meet you in person and get a broad view of what you do provide. And I think you did a very good job of that. So thank you very much. And with no other questions from the committee, you have a wonderful day then.
You too. Thank you.
Thank you.
Right. Good.
Thank you. We have Stephanie returning for the NCTV proposal.
Okay.
Hi again, everyone. Thank you. I'm putting my director of programming hat on for the ACK Ambassadors grant proposals that I've submitted to both the Human Services Programming grant and the Substance Prevention grant. So the CRC gave us seed funding for our pilot for this program in 2024 fiscal year. And we chose not to come back to you in 2025 for the fiscal year 2025 because we were still working out what we learned from that program and the direction we would love to move in at NCTV. Nantucket Community Television is known for the broadcasting, but we're moving into this social educational innovation space where the programming that we put out into the community is meant to engage people beyond the form of entertainment, right? And tie people into moments and points of connection. In my grant proposals, I mentioned this practice that happened in the 70s, the Rat Park experiment, and that was by Bruce Alexander. And what that was essentially was they put rats in a cage with nothing else but two sources of fluid. One was drug water and the other was plain water. And the rats eventually took to the drug water without, choosing to drink the regular water over and over and over and over again until they overdosed and died. And so Bruce Alexander, what he said was, okay, well now let's try to look at if we introduce stimulation into the cage. So they added like a wheel and some toys and another, rat to sort of run around in the maze with, and they kept the drug water and the plain water. But what they found was that the rat never went for the drug water because they were stimulated with connection and purpose. And so what this experiment says is that addiction thrives in isolation, and that connection combats addiction. And so what I'm learning through the ACK Ambassadors program is that cultivating connection and creating points where people can feel connected to both themselves and their peers and their community, that is prevention in the works. And I believe that our program got funded way back because there was a creative new take on prevention in terms of our proposal. And so I wanted to express the ways in which we would like to continue the program. One of the grants, I am asking for support when it comes to our curriculum and the development of self-workbooks that will be used to engage students in their connection to themselves. Based on our pilot series, what we sort of realized was if we give students some resources, such as videos that talk about their growing brains and their capacity within their growing brains, and introduce them to the science of what their brains are doing and what they seek, et cetera, it really engages them and makes them sort of interested to learn and to also nurture their brains. We also learned that if you ask a student, what is your value? What do you value in life? They often get quite jumbled between what other people value or tell them to value. And so they weren't able to authentically state that for themselves. And so I've worked with Dr. Price, Margaret Ann Price at Fairwinds, Rachel Merriweather at Fairwinds, Susie Tapley at Mast. And we have recorded these videos that are not self-help videos. What they are impromptu videos that we're now shaping to bring students through this experience of getting to know themselves, learning their values, identifying them, building their foundation, and reminding them that they have power. Rachel says in one of her videos, we have to stop telling teens and kids that they don't have any power because they will start to believe it, and they do have power. And so breaking these biases and really just breaking through them and allowing for the kids to do that themselves as well, that's something that these videos are meant to sort of like foster out of them as well. So I'm working on a curriculum. Right now it's broken into 5 units. The first unit gets into a couple of videos that we have already shot using our pilot funding as well. And it gets the kids into knowing themselves. And it's called You Know Yourself Better Than You Think. And so it talks about their sense of belonging within their bodies as vessels, and what that means for them. And then it drives them through a few exercises in terms of connecting with their breath. And then it also activates a few prompts, reflection prompts, where they can write and sort of reflect on, you know, what does it mean to feel like I belong in my sense of self? Like, do I belong in my body? Do I ever feel like I don't? You know, and then it gives them sort of that self-workbook curriculum to walk them through that as well. Unit 2 is about values and foundation, because when teens identify their values, then they can decide, oh, okay, does this choice align with my values? Am I feeding my values, or am I starving my values? And then they're making sort of purposeful choices at every turn. You know, directing your life, directing in general is making choices, choosing a direction to go in. So if they are being held in a space where they can sort of identify their own values and what matters to them, as opposed to what people are constantly telling them to value, and not giving them the space to learn that for themselves, we think that that will go in a really positive direction. Unit 3 is about choice and power. You have agency. How do we cultivate more agency? How do we hold space for you so that you can explore your agency? And how does that pertain to choice? Unit 4 is emotional and courage. So, you know, what emotions are you feeling? You are valid in feeling your emotions. And every choice you make is a courageous choice in this day and age. And so we tap into what those are and what's actually happening within the brain when you make choices based on your emotions and based on bravery. And instead of just that this is the only option I have. So unit 5 is all about, you know, sort of recovery and what does that look like, and then expression through art, because we don't want to lose the through line of public service announcement creation for the community. It's just that if we ask teens and youth to make public service announcements to contribute to the health and safety of our community, they are doing so from a place that's misinformed and not aligned with their true self. So we're sort of taking a step back, looking at this as, okay, let's create some meaningful work that we can present to the kids, where it might be fun for them to get to know themselves on a new level, and do so through more video content, because they will never not have video content to ingest. That's the other thing. Social media is another form of addiction. And we have some school to career students who have been really helpful throughout this whole process. And they're high schoolers, and they talked to us a little bit about their use of phones and how the new rules where they put their phones in their pouches helps them throughout the day, but it doesn't fix that immediate, okay, we're out of school, take it out of the pouch, and then they're in that world for 9 to 10 hours a day. So we can't say that they'll never be on their phones, but we can combat the things, the materials, the content that they do watch with generating meaningful content that is designed for them and gives them resources that they wouldn't necessarily have or go and seek on their own, or perhaps like their parents' insurance doesn't cover it. But if we bring some mental health professionals to address the kids directly into the camera, to provide them with tools and resources and equip them, and then hold space for them to have these conversations and build out these reflections, and then to identify with what matters to them, what they fight for every day, then perhaps they will feel more equipped to move out into the world, make choices that are healthy. It's creative prevention. But yeah, I'm super passionate about it. It's what the majority of my time goes towards, among other things. But thank you for holding this time for me.
Thank you. Thank you for that explanation. Do we have other questions, or from the committee, any comments? With no hands up, I want to thank you, Stephanie. You've patiently
We did have 1 or 2 questions that were pre-submitted. I can collect the answers to those offline and then get them back to you guys ahead of deliberations.
Okay,
There's
thank you.
A couple of questions regarding data analytics for viewership.
Okay.
Yeah.
All right.
And then,
Thank you, Jericho.
one
Alrighty.
final thing, may I say one final thing?
Yes.
A lot of questions that we get when I apply for grants for this program is, if you don't get the full funding, will you just do less? And I I always respect that question because you guys have very limited funds that are used to put into these programs, and you do help a lot of different organizations with high requests, including ours. It's just, I want to reject that premise for 1 minute, because if a teen or youth were to say, can you do less? If you get less money, or will you scale it back if you have less? And yeah, of course we can. I just feel as though that is a premise that needs to be rejected sometimes, especially when it comes to the youth, because if they're constantly growing up in a community that puts them at this risk of receiving less, then they will always be feeling as though they are receiving less and not more. And so I think it's my job to squeeze the funds to the most that we can, the capacity that the funds are capable of expressing through creative content, material, development time, engaging them. But when it comes to doing less, I don't think that they deserve less. I actually think that they deserve more. And so my goal with pro bono access with clinicians, yes, I can ask people to do things for free, but I wonder if we can, bring some people in, or have some extra funds to sort of cushion that experience. What then is the capacity in which we are receiving, as opposed to feeling as though we're cutting corners for the sake of our youth's health and safety and mental well-being.
All right, thank you.
Thank you guys very much.
Thank you, Stephanie, for being with us this morning here. We appreciate it. All right.
It's a great morning. Happy
All
Friday.
right, great.
Thank you.
And next up, I see Michelle up on the screen. Welcome, Michelle.
Good morning.
Okay.
How is everyone?
We are well.
Okay. So year three for this program. I'm excited to say that we've made it this far, and it's been pretty successful. A little bit slower this year than it was the first year, actually. Just in regards to, we started off, in July. So we've had 5 sessions since July, mainly because I'm trying to spread the funds from last year throughout the year so that we can continuously offer something every month for the kiddos. So I did see that you guys had a couple of questions in regards to transportation on Saturdays.
Yeah.
And fundraising on how exactly are we going to go about that. So let me start off with the fundraising part, because I'm pretty excited about this. I spoke to Rocky just a few days ago from the Chicken Box, and he is very excited about this program. He had not heard anything about it. He was just all in. What can I do to help you guys get this going and keep this going? And he had a million beautiful ideas. So we're hoping to sit down over the next month or two. The holidays are kind of busy and the weather hasn't been great on getting over there. So, but we're hoping to sit down. He was suggesting that possibly I do an awareness, offer an awareness event over Zoom for the town, and see if anybody would like to join and hear more about the program and who we can serve. He was also excited to find out that this past year we've had a few new participants that are on the older scale with autism, and we've had huge success with them coming out. Separating from their families, getting on the ferry and going for the whole trip over to the farm, which is an experience all in itself, and have returned multiple times. So I feel as if the word is starting to get out. We're spreading to the groups that truly do need this type of program, the experiential learning and working with the horses and building leadership skills and body regulation. I feel as if the word is getting out there. And now with his support, I think that we're going to do quite well this year, and really being able to attract more kids and young adults that could really utilize this type of environment. So I also have reached out to Cisco Brewers to see if we could set something up with them. And I did send an email over to the library, because I was hoping that possibly I could do something over maybe Daffodil Weekend, just kind of like, just be there and be open for questions and answers, and possibly have a slideshow of what we have been doing here the past, 2 years with the kids from Nantucket, so a year and a half with the kids from Nantucket. So yeah, I feel like we have a lot of things really up and coming and moving forward to help support the program so that it has some longevity.
Right.
And then in regards to the transportation on Saturdays, what were the questions around that?
Right. I'm not sure who brought forth that question.
The difficulty, it was just around logistical difficulties for transport over the summer, specifically on Saturdays and Sundays. Have you run into any?
No. So we don't run programs on Sundays at all.
Oh, sorry, I meant Saturday, I think was.
Saturdays. During the week was definitely a little bit harder. We did run a couple of days over the week just because the Cape Cod side was busy with the public transportation, because I have to schedule that a week in advance. But this Saturday transportation, I have not run into any hiccups other than a bus was running about 7 minutes late one of the days. And that's not not really an issue.
No. All righty.
So, but besides that, it's been a super smooth transition. I hold 12 seats every Saturday with the High Line. It's consecutive. They know that it's there. If we don't use them, it's not a problem. But either way, they're held for us permanently. And same thing with the B bus. They primarily have a bus, that's available for us to use, as long as I have 4 or more kids, which I always have 4 kids plus 2 adults, if not 8 kids and 2 adults. They hold the whole entire bus for us, and they pick us up, between 8:50 and 9 o'clock at the terminal and bring us directly to the farm.
And actually, for Lee and Suzanne, who are new to our committee, I just have to say, Michelle runs a very tight ship with how she organizes, gets the students or the children off the island. She comes over on that early ferry. She meets them. She engages them on the ferry in the entire day. The program is incredible. And then she gets these clients back and safely and with much success. So it's, very, very well organized and thought out and with lots of passion. For sure.
My apologies. I didn't realize that we had some new people on board. Yeah, I can give you a quick rundown. So we, I provide lanyards over at the Family Resource Center, and that is where everybody signs up and gets the information. That way, both the state has, they get to document who's coming through their system, as well as, the town does. So when we give the kids lanyards, blue lanyards, we meet in front of the surf shop. I ask them to be there at about 7:25 because both myself and whoever is working with me as a support, we take the very first ferry from the ferry over, from Hyannis over. Everybody's waiting for us. The High Line has it down so that we have 2 tables that are secured for us. So we're always, having consistency is really important for some of these kids that we're getting. So we have the 2 tables that are in the front of the ferry for us to sit at. We get them right on. If there's a couple of kids that are lagging behind, High Line escorts the kids up the ramp to make sure they get to whoever's holding the 2 tables, whoever my coworker is. We play games on the way to, on the way over on the ferry. The B bus, again, like I told you, is there. It's worked out well. Usually I'm in the front of the line and we just play follow the leader. We're teaching the kids immediately when they're on the boat about having respect and having patience. Everybody gets off the boat before we do. And not all of the kids love that idea, but it is about having respect and learning about having respect, patience, and how to handle yourself, right? There's got to be some body regulation involved in that. So we do run a tight ship. So I'm in the front of the line or behind, depending on who I have that day and what the behaviors are. And a person in the back, and we get on the B bus, and they have to give their name and their age, and we sit in and we buckle up, and then we head to the farm, and we have breakfast ready for them. They do a pre-assessment when they get there, just a quick 5-6 questions to find out where they're at, to see what skills we need to maybe zone in on for that day. And then we get right into working with the horses and learning how to drive tractors, and a lot of really, really good fun stuff. And we have lunch, and we provide them with snacks for the way home. We also provide any type of clothing that they might need, whether it's closed-toed shoes, boots, socks, hand warmers if it's chillier out, hats, jackets, and the same thing with t-shirts if they get wet because we've been painting the horses and we're going to wash them. Do you know? So we provide absolutely everything for these kids. And then it's the same routine on going home. We work well with the ferry changes because they do change the ferry schedule. We've been able to coordinate that with the busing transportation as well. And we haven't had any, we've been blessed. Like, we have truthfully been blessed. This ran way more smoothly than I have ever expected to, and it has continued to just go that way. I do have an RN on staff. She's here every time we have a session, so that I want to make sure that, you guys from Nantucket have allowed me to take your precious beings and your children and your family members off island. So we've made sure that I have, at least 2 to 3, if not 4 equine specialists that are here that work, side by side with us. I have an RN and plus myself to facilitate, and a male facilitator if we seem to have more boys. So everybody can relate. Everybody's always included. The age range has not been an issue. We've had kids that are 8 years old, 9 years old, up to 22 here at the same time. And we've been able to have enough staff to support everybody and all of their needs.
All right, good. Thank you. Thank you very much. Any questions from the committee?
This is Suzanne. I just wanted to say I went online and looked at your program, and I just wish that I could participate.
Please do. If we offer that. If you guys get a group of you together that would like to come out, please come on out. I just came back from North Carolina a few weeks ago to add on to the curriculum that I have, because I do there's a curriculum that goes with this. There's some scientific evidence to support what we do, which is why we do the pre and post assessments, is to continue with that. But I have a contract with Newport Academy, which is a residential facility for the teens. Over in Katama, and they come out on Sundays. But I worked with their team, their employees, for all of November and December, and brought them through this program so that they could see exactly what we're doing. And I have to tell you, they had a fabulous time. So please, if any of you would like to come out, let me know. Let's schedule it. It's healing and healthy for us. It's all stuff that we need to work on as well. Being present, being mindful, communication. All good stuff.
And, from personal experience, because I did have the opportunity to visit and run through the program, not just for children, adults, and not just for individuals struggling with whether it is addiction or other issues. It is a growth experience that, bar none, fabulous. So thank you, Michelle.
Thank you for the kind
appreciate
words.
what you're doing, and appreciate, and we appreciate you working with our island youth. So thank you. All right.
Thank you.
All right. Have a great day.
All righty.
All right. And next up, I see, do we have the warming place?
Yes, we have Deb in the house.
Okay.
And I'm phrasing it, but it's
All right.
accurate.
All right. Deb?
Good morning, everybody.
Very good. The floor is yours.
Alexandra sent me a few questions that the committee had. And one was, what's our plan if the churches reclaim their space? Which I guess everybody's sensitive to because of what happened to the food pantry, I assume. I'm going to answer it in 2 ways. Our very next goal is to establish a permanent shelter. So the board has recently begun to figure out what services we want to offer, and then that will kind of drive the needs of the facility. For instance, a commercial kitchen, showers, space to do case management. The lack of affordable housing here is making, I don't want to say, I guess it's a little more difficult for us to figure out exactly what we want, because a lot of other places have transition housing where you could move people from a shelter into that. And we may need to accommodate some longer term beds in a shelter because it takes more time to find housing on Nantucket. So we're just in the beginning stages. We've also organized our advisory committee with skills that should help us there. So we have Dan Dunlap, who is a realtor on the island, Christy Ferrantello with Housing Authority, and then Susan Mazzarelli, and she's in New Bedford, but she's from the Catholic Charities for the Diocese of Fall River and runs 5 different shelters. So I think we're pulling the expertise together so that we have a broader picture about what we need to do. So that's kind of future. I mean, we really hope in the next couple of years to be able to do that. Short term, we do have commitments from the Congregational Church and the Summer Street Church for this season. And if something happened, I don't think it would happen to both spaces, but let's say one space, I'm confident that we could go back to the Methodist Church and the Unitarian Church where we were 2 years ago. So I think that would be, worst case scenario, which knock on wood isn't going to happen. But I think it was a good question to ask. We have looked at one space as a permanent shelter, but we're real early in the discussions. We're like gung-ho, but the people who have the space aren't as gung-ho. So we have to work through that, and I hate to say politics, but it is politics of that organization. So we know that we need to do something. We don't want to be caught in a limbo or, not have a space. Any questions on that area? Okay, the second one was on fundraising. And there's 3 areas of fundraising that we kind of group our effort in. The first is applying for grants. And the last 3 years, we've raised at least $85,000 a year. What's a little tough now is with the current administration, they're cutting back funding for homeless shelters and transitional housing. And so, we still look for those grants. I'm on the federal and the state grant search. And so today, for instance, I got 2 potential grants that didn't fit for us, but we're always watching. We're also looking to engage a company who would actually be looking for grants and applying for us, which we think is smart. There's a number of companies who do this for a living, so they have a much broader reach than we do, because frankly, right now I'm doing that work and I have limited time to do. And so they take a small piece of the grant as the administrator. And so you don't really have to invest your own money in order to do that. So we're looking at that. Donations are important to us. One area that we really work hard in is food donations, meal donations. And this season, 6 nights a week are donated meals from restaurants, Knights of Columbus and St. Paul and Nourish Nantucket and a couple of restaurants, the Brotherhood and Siam To Go, which is new this year. So we have really good food coming in. We have 2 lunches, and Island Kitchen is doing one, and one we're still looking for another partner, but we're paying for that out of our budget. So we do work very hard, even though you'll see we had $20,000 in the budget because we have to budget for that in case we don't get donations. But right now it looks like maybe we'll only have to spend around $5,000 for meals this year. So we do work hard in that area. And then there's the traditional fundraising. Our annual appeal just started this week. Last year we raised $120,000. This year we think we've really raised the awareness of homelessness on the island and also of the homeless shelter. I think that nice article by Amy Lee was really good. This morning I noticed the Inquirer had a little blurb on both the food pantry and us that it's getting cold. And so I really think that that's happening. We also have a major gifts program. We have a goal of 200,000 this year, and we have 120,000 already, and it's early in the year. And then this summer, we're having our first benefit. So we're joining everybody else in benefit, but we already have co-chairs for the event. The Dreamland has already given us free space in the harbor room for the event. We have a short film that we were filming yesterday and today at the shelter that's being done gratis by Patrick Kennedy, who did Room for Us don't know how many of you saw that film, but his work is really super quality. So again, we really try and get as much as we can for very little money and then do our fundraising. So any other questions in that area?
All right. Any questions from the committee? All right, Deb, I just want to make a comment, having watched the organization grow in the past couple of years, you really have done so much in a short period of time. And I know that the official season has just opened for you. And so best of luck with the coming season and helping our unhomed on the island. And I also want to just make a comment. It's wonderful to see the island restaurant community really stepping up, not only with providing meals for you, but I've watched some things that have been posted on Instagram with some challenges that donations going to the food pantry and whatever. So I just wanted to say thank you. Thank you to the island restaurant community for helping out with our residents in need. And thank you, Deb, for all that you do. And best of luck.
Thank you.
Best of luck with your benefit. And one last question. I know that you were advertising for a manager. Have you been
Yes.
successful in finding someone for that role?
Yeah, we have an absolutely wonderful person, Lucia Redondo, and she worked for Health Imperatives. So she has a lot of experience in case management. She knows the various social and medical programs. So we're really bolstering what we do on site, helping our folks with the support, of course, of our partners, the social services department, the hospital, the Family Resource Center, and Addiction Solutions, and Fairwinds. And so that's really good. And she's bilingual. And we have about 50% of our guests or more now are Spanish speakers, which is good because we've gained the trust of that community. And she just makes, such a difference because some of us know a little bit of Spanish, but she's fluent, and not only fluent in Spanish from El Salvador, but also Spanish and from the Dominican Republic and some other countries, which surprising how different that can be. But she's become a great asset and has just stepped in, knows so many people in the community. So it wasn't hard for her to take over the role. So we're thrilled. It's great.
Well, kudos. Wonderful.
Great. And thank you all for your past support. It's really been very meaningful for the program.
Well, thank you. Thank you for coming in today.
Yeah.
And have a wonderful day. Great.
Have a good weekend, everybody.
Thank you. All right. Next we have up is Nami and Jackie.
Jackie Lane online.
All right.
And then we are running a tiny bit behind. We have Jackie Lane. Next up is also Elise Norton and Jackie Lane. So we can do the
Okay,
two
so
run together.
we'll go from one right into the other then. All right.
But we have the NAMI application up first.
Okay.
Okay, this year, NAMI decided to do a capacity building ask. It's under the operational category that you had this year, because we feel that we really have been missing out on some of our core programming, our free programming that we had built up in the past when we had the history of coming on the island. And in my grant, I kind of gave the history of NAMI on the island. And so I think that in this climate, both political climate and economic climate, that's really important to go back to core basics. And the core basic programs for NAMI, which were ones that were started on the island way back when, were essentially our free family-to-family classes or borderline personality classes. Also, basics, which is a class, and all these classes were free. They're by trained people that have lived experience. And I think lived experience is a key for NAMI. And we believe, and I know you're on an island and it's very difficult, but we were doing all this stuff live before COVID and before we went into the Zoom business. And of course, now we can expand things by doing Zoom. But most of the people that we have and our teachers really prefer for what we do the in-person. We really do, because so much of that type of programming and our support groups, again, which are walk-in and free, it's based on people looking and talking to people that have the same issues, and that kind of interfacing, and even during break, those little side conversations, private conversations. So I really want to get a lot more in person back on the island. We've always had at least one paid employee ever since we had money to do it on the island. And now we are looking, we have one now, we had two, now we have one because of lack of funding. And I want that funding back because Elise, whom you're going to be hearing from shortly, was, we took over her payroll about 4 or 5 years ago from ASAP. And she has been concentrating essentially on addiction programming, and which we found very valuable because it marries addiction issues with mental health issues, and they always should have been in the same. I mean, the fact that they were separated in 2 separate silos was ridiculous, in my opinion, because obviously if you are addicted, you have a mental health issue. And and about 80% of the people that have addiction issues, it really, the root cause is a mental health issue of some sort of another. So that makes a lot of sense. But at this point, we don't have anyone that's paid to do our core programming and really make it happen on the island. We don't have the money in our operating budget at this point. We always had furnished money. And then when we had our fundraiser, which was originally our fundraiser, Dragonfly, we had the money to do all this. And I also had the money. I've spent personally a great deal of time working on the island because as part of that whole process of coming up with community solutions. I went through all that. NAMI was one of the 4 founders of that whole thing, along with Fairwinds, the foundation, and the hospital. And that was very time consuming. And so what I've done is prepared a budget that we would need in order to put, I would say it was a capacity building budget to bring us up to the level on the island that we're on the Cape. And I feel that we've slipped some on that one. And a lot of this budget is self-sustaining because some of it is like if you train people and they'd have to come off island to be trained, all our people go to Boston to be trained, and we have that expense. But once they're trained, and there's no expense involved. The big expense is to hire another person, and I do have the person that I want. And it's only for 10 hours a week, but it's $35 an hour plus the payroll expenses, your taxes. And I think 35 is about as low as I can go on Nantucket. It's a little expensive to live there. And this is more than I pay here too. So I've put my budget, and I've, in order to do all of these, to get all our basic programming back, plus we want to have new primers printed. We're in our 5th edition of the primer. We need new marketing materials. We've kind of let those go. And we've always done special stuff for Nantucket with really a Nantucket identity, which I think is important. So that's what we're looking for. So it's a capacity building investment. It's really an investment. And I feel that a great deal of it is self-sustaining, that it won't be, once you print the materials, once you train the people and so on, that's a one-time expense. So I really want to be back on Nantucket and as strong as we started out before COVID. And I feel that between losing the Dragonfly funding and then the whole COVID stuff, it's we're not as strong on that island as we really, really want to be. I'm very dedicated to Nantucket. I have a history with vacationing on Nantucket back in the good old days, and I know my husband's roommate at Cornell was Mitch Havemeyer, Mitchell's Book Corners son. I mean, so we have a long history of knowing Nantucket and appreciating it. And I really want to do my best for Nantucket. And I don't feel that we can with the situation we have now. So that's kind of my story.
Okay. Thank you. Thank you, Jackie. Just one question that I do have. In the past few years, we have funded the gap funding reimbursement for therapists, and you know, that I assume is being phased out at this point. Or
Yes, I don't want to phase it out, and I am going to try to look for some private funding for that if I can. But that program costs us around 120,000 a year to run it at the rate we were, which was limiting each therapist to $2,000 a month. And I also, the funding kept going down and down. Again, we never had the full 120, but when I had that extra Dragonfly money, I could fill it in. But without that extra operational money, I'm down to my grant this year, well, the 25, it would be what, 25, 26 grant, I think is 51 or 53,000. And what I've done is notified the therapists that we will be running the program the first 2 quarters, and that money will just about cover that. At this point in my operating budget here, I can't make that up. If I can find a private donor or two, then I really, because I believe in that program, I really do, but I just can't fund it out of NAMI's normal operating budget right now.
all right. Well,
I
thank you
will
for that
try.
explanation. Yeah. All righty. All right. Any other questions for Jackie? And if not, we'll go on to Elise Norton, who is waiting, and the application is ASAP NAMI. So we'll turn the floor over to Elise.
Good morning.
Thank you,
Thanks for
Jackie.
having me. You guys had a list of questions for me. Do you want me to just go through them and
Yes,
my
please.
answers, or you okay?
That would be
Okay, so the first question on my list was regarding the cost of live streaming. So we are offering a program for an educational program for adults in recovery. It's a healing arts program, so they would learn multiple modalities. And we're interested for the first time in offering this program remotely as well as in person. So we're looking to purchase some recording equipment so that the programming can be live streamed for people to log in at home, but also recorded in perpetuity so that they can revisit the classes, whether they attended in person or remotely, at their convenience. The one of the most important components to the recording equipment that we're looking to purchase are the microphones. Now, if you've ever taken a sound work class and or ever been in a room where someone is playing those Tibetan bowls, it's real, like we feel that purchasing these high-end microphones to record the sound from the bowls is really important, because the resonation that comes off of the bowls, and Sarah Todd is here with me today. She's one of the practitioners and managers at MAST, could speak more to it, but I'll just say it's just really important. The resonation, the vibration that comes off the bowls is where the healing works on your body. So it's just we can do it through the computer laptop. It just doesn't get the same effect. So, hopefully that answers your questions. I think
yes, it does.
there's a lot of importance in recording and in the quality of recording.
Okay. Thank you, Elise. It does answer it. Yes.
Yeah, absolutely. There was also some question regarding the mental health support. So we did mention in the grant application that the practitioners are also, you know, have some clinical licensing so that when the guests are here taking these classes, a lot of times the breath work and the sound work, it can really bring up a lot of heavy emotions for people in recovery. You know, recovery oftentimes comes really embedded with a lot of trauma. So a lot of this work is working through that and processing that. And so this is not intended to replace any kind of therapy they are participating in, any kind of recovery coaching they're participating in. This is to kind of like stack onto that. We just have licensed practitioners who can support these people in their mental health journey through the process of breath work, of sound work, of the time that they're at the Mass Center. So hopefully, does that answer your question there? And does anyone have any other questions regarding that?
That's adequate. Thank you.
Okay, amazing. Now this program, we've been running a very similar program with high school students and college students over the last few years, and you guys have very graciously funded multiple years of this programming. It's been very successful for us. The young people that have participated in this programming have responded very well. It's been very helpful for them. The goal with that was to teach the young people how to manage stress, anxiety, depression, things that Jackie touched on before, oftentimes lead to substance use, trying to get ahead of all of that and give them tools that they can use to cope versus self-medicating, right? Now, through the success of this program, we started talking about how we'd really like to bring this to the adult community. So through conversations with community members in recovery, we designed this program to fit their needs. And one of the things was the timing of the programming. So we are looking to run the program January through March 2027. And that's because they've expressed to us, one, winter months are the hardest, right? We all know that's like a really challenging time. It's an especially challenging and triggering time for people in recovery, right? So that's when, and also a time when they're available to attend this program. So these are skills and tools that they will learn in this program at this location, but they will take with them into their life, into their everyday life, into their extended life, you know, beyond the end of the program. We did, so winter was important to them. So that's why we chose that time frame. We also did discuss with them kind of how to space the programming out. Do we do it once a week, multiple times a week, and for how many weeks, right? So we want to make sure that we're seeing them at a frequency that works for their busy schedules, for their life. They have a lot of other programming they're already participating in. So we're not trying to overwhelm them. So we decided on once a week, and for the 12 weeks, being that it's important to in order to affect, you know, to make effective change in our life, we need to practice things for you know, at least 3 months before it really like, you know what I mean? Before it really sets in and then it becomes like a lifestyle that we're taking on. So we want to make sure, so we're seeing them for enough time that we're
Okay.
really helping them to adapt these practices into their everyday lifestyle. They're, you know, be doing this on their own once we set them, you know, once the program's ended, that we're confident this is something that they're, you know, comfortable doing in their life and that they're, you know, going to be able to do on their own. Because meditation, breath work, movement, all of these things are things they can practice on their own, in their own safe spaces, you know, they outside of the class. So we're just giving them the skills, we're practicing them with them, you know, like learning a new instrument, right? So we're practicing with them and then they can go home and they can practice these things on their own time. I know I'm looking over like the budget we proposed and I know that the space looks like it's costing quite a bit of the budget we're asking for here. And I do appreciate the idea that we could consider a different space. But we can't really. If you've never been to Mast, you don't know. But it is a magical space. And I think a lot of the healing starts and the effectiveness starts walking in the front door and entering the room where you're going to be, you know, doing your class. And we can't get that in the basement of a church or, you know, anywhere else on the island. I feel strongly. I've been there and I've taken classes there. I've had the pleasure of sitting in on some of the high school programs we've run and just seeing how people respond to being in the space. And I feel too that welcoming them in, just making them feel like this is a space where they belong. A lot of people probably wouldn't ever feel that way. Like they just feel, oh, I don't belong at Mast, you know. That's not, you know, for me. That's, you know, above my pay grade to be candid, right? But so it is really special to be able to offer them this space for free, offer them this space to come and do and start their healing journey. So I feel strongly about using that space. So I hope that you guys can all get a chance. They do offer some free programming, and you should look into their website and their calendar. And if you've never taken a class there, you should look into signing up for something, and find something that fits your schedule and your interests, because they have like a huge array of programming that kind of covers all different abilities and skill levels and interests. So.
Yeah. Well, thank you, Lise. And just in consideration of time, Jericho, you're our timekeeper up there.
A touch behind.
Yeah,
About
I
that?
didn't touch on all the questions. So does anyone want to hear anything else from me, or does that really help you guys, what I covered so far?
I think unless we have questions from the committee, I think that you have. So thank you very much for taking the time this morning and giving more explanation. So thank you and have a good day. And we appreciate your time.
Thank you.
Thank you guys. You too. I really appreciate your time. Thank you and your consideration.
Okay, very good.
Bye.
So next up we have Addiction Solutions. So Dr. Lepre and I'm not sure.
We have several people from Addiction Solutions in the house. We also have a couple of people remoting in, and I think you guys can take it from there.
Okay.
Okay. One question that was brought up is a succession plan. Obviously, I'm not retiring and reports of my demise are greatly exaggerated. On the other hand, I think it's reasonable that the way we're moving that we sort of have a plan, and we do. We have my daughter who is a nurse practitioner and is a part-time employee of Addiction Solutions. We have Katerina Armstrong, who is a boarded physician in addiction and infection control. She is up in Newton Mosley Hospital and at present comes out 1 to 2 days a month and sees patients. And she's very interested in picking up part of the mantle if I do not do well. And Aileen Womack would be on, although she is not that much younger than I am, will be keeping the clinical situation in bounds. So that would be the succession plan. I would think that I can see all three of them working together to keep Addiction Solutions going. Now, what are our plans for the future? We do medically assisted treatment of addiction, primarily drug and alcohol. We occasionally have somebody that's using stimulants. That's a little bit trickier to deal with, but we'll take anybody that walks through the door that wants to deal with their addiction. What we'd like to do is, we currently have 2 nurse practitioners, 2 physicians, and Aileen. We have a front office secretary, and we employ Duncan McDonald. I have a nonprofit, which this is, and then I have a no-profit, which is my practice. So I have him doing that part of the office.
And we started with
Amanda. And Amanda, we hired a licensed social worker. We did that because in the gray and distant past, when we received money from the Rotary, that was one of my intents, was to get a therapist in there. And we did for a period of time, and it was somewhat unsatisfactory. And then we found Amanda, and she has really shown her worth in being able to evaluate our patients and give us a heads up on what she thinks about dealing with their addiction. How have we been successful? Well, there hasn't been an opioid death on Nantucket in over 1.5 years. How do I know? I'm the medical examiner. So if you die, I'm gonna have to show up and I'm gonna have to find out what you died of. So I can say that. We've had people with alcohol, but weren't under our auspices. And recently had one gentleman with stimulants, but no opiates. We see patients currently Wednesday evening from 4:30 till whenever, Thursday evening 4:30 to whenever, and Friday mornings. We just came from there. We currently, on Wednesday, Meredith Lepre is working there, along with myself and Aileen and Amanda. On Thursdays, we've had Natasha Feeney, who is a psychiatric nurse practitioner. She's there Thursdays and Friday mornings with Amanda, Aileen, and myself. We would like to probably expand our hours because we feel that there are probably people that can use unavailability as a way to not confront their addiction. The phone number, if you call Addiction Solutions, is me. For better or worse, you don't get a secretary, you don't get an answering machine. I answer, and then we work out what you need and what we can provide. And so sometimes people are surprised when they call and I say, well, why don't you come here in an hour? And we can work that out. So we need more hours. We also are looking at increasing our injection component. For example, right now I write a prescription for Suboxone, and we do test you every time you come near the place, but there can be diversion. So that's Suboxone with the pills or the films. It can be with naltrexone, But then if you inject them with it and it's good for a month, it's a little bit harder to divert. It is a complicated process because you have to go about 14 different levels of flunkies before you can get an okay to get this medication. Then they have to call the patient has to call them back, say they really want the stuff, then it gets sent to us, and then we'd like to set up probably one day every 3 weeks where we'll do nothing but shoot people up. Now, obviously, I'm not giving injections, so I probably will be seeing patients, but all of the other staff will be. So that's another area we would like to improve on. If you can do injectables, then you know the patient's all set for a month. We do it some now with Vivitrol. Vivitrol is used for alcohol, and we've got somebody that we've gone 50 months and they have finally graduated off of the Vivitrol. Probably doesn't have as much room in her butt left that we can shoot up. But it's very effective, and it removes the possibility that they're selling it.
To add in terms of
Yeah.
our plans for the future. So one of the other issues that we're just beginning to explore is working with a specific patient population, and this group would be working with the local probation department. We've met with Judge Sullivan, and we've met with half of the defense attorneys on Nantucket. Judge Sullivan is very, very enthusiastic about doing this. And that provides a very unique opportunity for us to work with them in a way that if the probation or pre-probation happens and someone has an alcohol or a drug problem, and they were willing and voluntarily would come to Addiction Solutions, Amanda would work with them very closely, and we would provide reports as requested by the patient and their probation department, with the idea that charges could be reduced or eliminated after a specific period of time. Now, that lends itself well to going back to the injectables. There are other drugs that we use. We're just investigating Brixadi, and we've already talked about Vivitrol. The problem with those is they're very expensive, and if someone has insurance, the copays are very high. And so we're looking into ways to see if we can get them funded in some way. We've been begging the pharmaceutical company to give us samples, and this is how we've been managing it. What else? You had some questions.
I think if you look at the court report each week, you will see probably the largest number of miscreants that are down there involve drugs or alcohol. And it's a tremendous problem, and you can't sort of jail your way out of that. And you have to provide an alternative. And the alternative would be being involved with us, getting tested. And I think that is an avenue we're very excited about. We had Amanda go down to court, not as a guest of honor, but just as an observer. And she thought that the people she spoke to, we had spoken to Judge Sullivan before, but speaking to the district attorneys and some of the defense lawyers, that they sounded very interested in, and we're moving along those lines.
There are some other concerns that we have that I'm not sure if you're aware of it, but there are synthetics that are out there that don't show up on the screenings that we're doing now with the urines that we dip. these synthetics are currently legal and are present at Cumbies and at Smoke Shop.
Kratom.
Kratom. It's,
Well,
there's,
bath salts are around all the time.
yeah.
Yeah, but Kratom is a newer,
Yeah.
that you can purchase at Cumbies.
And so, we're very concerned that we're gonna start seeing an increase in people who have dependence on these, and they're so readily available. So one of the things that we're talking about is changing some of our urine protocols and getting special cups that can pick up those synthetics where our current ones don't, and then trying to work with, and this may actually feed into what Elise Norton was talking about with teenagers, because these things are available and they're targeting people under the name of like Calm or sleep or whatever. And in low doses, they make you feel more calm, but in high doses, they're addicting. And they're very much like opioids. Dr. Lepre actually had a patient that he treated that was addicted to this, and he treated them with Suboxone. So that goes back to what our medication clinic is. You've got, he answered the question about succession plans. You wanted to know how many individual patients we were seeing. This year, we've seen 885 patients, 41 of whom were new to Addiction Solutions this year. And that broke down essentially into more males than females. I think we had about 230 females and over 600 males. So we're very heavily male dominated. We have patients who have insurance, as you well know, but Dr. Lepre is very clear about if they don't have insurance, it doesn't matter. We want to be able to be in a position to treat you. So by having Natasha on board now and Mary, they have prescriptive privileges, which means if Tim is not there, they can actually prescribe medications and have that sent in electronically to the pharmacies. We have Katerina, who is coming down monthly and is developing her own panel of patients. The process that we go through is every new patient that comes to Addiction Solutions, I do the initial intake. And then depending on what we're seeing, Dr. Lepre and I confer with each other about what medications are needed. And then we offer them counseling if they would like to. Many of them are in counseling with other providers on the island, some virtually. And so we talk with them about counseling. And then with Katerina's specialty in addictions, we refer specific patients to her to begin following up, and then she and Dr. Lepre will collaborate. I'm Katerina's proxy when she's not here, so I kind of do handle the medication side of the clinic. Amanda handles the counseling side, and Tim and Katerina are balanced with both of us.
And I think the counseling side, I mean, many of these individuals are very receptive to the therapy, and some will have a therapist at Fairwinds, but still work with me, and I just focus solely on the addiction piece. They're seeing me every week or every other week. They're also know that I'm available 24/7. They can reach out to me. We had one young gentleman who reached out to us, and based on my previous crisis experience, I was able to get him into a detox at the end of the day, which is pretty amazing. And we're able to do that if we can't detox them safely on the island.
And this allows us to avoid having patients go to the ER. or having to be seen in an emergent situation. They have Tim's cell phone number, 24 hours. It's on the radio. Everybody has Tim's telephone number. Amanda gives the patients her telephone number, and the patients that I see are also available. And they rarely abuse the privilege, which is why we're very, very comfortable handing out our private telephone numbers to the people that we're seeing. And that probably speaks to the question that you have here about how do you plan for and manage increased summer months. We just do it. Jane Zeising is the person who does the scheduling with us in the front office, and she's very artful. And because we are very flexible in terms of trying to meet our patients' needs, we come in early, we stay late. If we need to come in, if Tim's seeing somebody on a Monday and he feels that they need a biopsychosocial assessment from Amanda, he'll call her and she'll come in on a Monday. And this is how we run Addiction Solutions. We really do try and meet the needs of the patients based on their needs. Our goal is to get everybody back into working, having a job, normalizing their lives. 87% of our patients are working. Your interest, it appears in some of the writings that you're interested in our new patients. We actually encourage returning patients. The longer we can keep someone in counseling and in therapy, the better they're going to do and the longer they're going to stay sober. So we're very comfortable having people stay with us. We had a young woman that I've been working with for over 2.5, almost 3 years, who came to us with a very, very difficult history. And she has remained sober for 3 years, and I tutored her so that she could take her pharmacy tech exam, and she passed with a 90. So it's not just what we're doing in terms of our hours, it's how we're supporting the patients based on the needs that we're seeing.
And if I can add, I'd like to add one thing. Marcia Egan, I'm Vice President of Addiction Solutions. Some people may know, some people may not know that Tim has never taken a salary for this. And when you look at what we describe as our needs, $60,000 of it is for staff. As you know, if he should back off, you can see that we're growing. And having both Katerina and Amanda are part of that. And that is critical to your question of succession, because
Yes.
we're building that as he continues to not take a salary, but other people do deserve to be paid for their services.
Exactly. And I see Dr. Armstrong's hand up. Dr. Armstrong, I see your hand up.
Having some issues with the audio.
Oh.
Unmuted, but their audio is not coming through. Let me see if I can click on a bunch of buttons. Get it to work.
Okay. Is Dr. Armstrong with us?
Give it another shot there. Yeah, there appears to be an issue. Yeah,
Should she call in?
no,
she's down on the lower right.
Yeah.
How about now?
Yes. Perfect.
Now-
Thank you, Dr. Armstrong.
Can you hear me
Yes.
now?
Yes, we can.
Okay, great. Sorry, my screen's frozen. I might have to take my screen down. I think that's the problem. So, a couple of things I just wanted to mention and to follow up on, and thank you so much for taking so much time with us. As Amanda, Tim, and Aline have mentioned, there's so much more than seeing patients and treating patients that goes into the work in Addiction Solutions every day. Touching upon the plan for the high volume months, that is a time that staff does increase. I know for myself moving forward, and even in the higher volume months, that's a time that I'll spend more time on the island. But also, we've been working on a plan that can incorporate virtual visits. We know in healthcare in general that is a way that, perfect scenario would be to have someone in person, but if they can't always be in person, doing virtual visits, seeing patients, even seeing new patients and getting them started on a medication that's life-saving is really, really an important thing that we've learned that we could succeed through COVID. And so both increasing my in-person footprint, but also virtual visits moving forward is something that I'm committed to. To speak on the kratom issue, kratom is heroin. It's touted as a natural medication that can help calm people, but the way we treat it in my clinic in Newton Wellesley is exactly like how we treat fentanyl and heroin. People can become addicted almost within the first few days at low or high doses, and it's something that our own patients have experienced. And we did have a near miss with one of our patients that kratom was part of his overdose. Fortunately, he survived. We treat it as we treat opioid use disorder, and not many people know about it, but we do, because we talk to our patients and we look for it and we know where it's happening. So that's really such an important thing for us to continue, and being able to test for it, as Aline pointed out, that finding these testing devices is just really, really so important for our patients. One of the other issues I wanted to bring up that is important, that we are already looking at, and we'll have a formalized plan to present metrics, but the metrics that are so important that we know in addiction medicine in general are new patients overall, follow-up visits, what does the compliance look like, how many people are continuing to follow up, testing, and that includes both that's the urine drug testing that happens, and the testing that is negative and positive. That indicates a person's ability to show the days of recovery, et cetera. Treatment that is started. We know that treatment, especially for opioid use disorder, but also alcohol use disorder, which is quite high on the island and statistically throughout the country, and certainly Massachusetts, it saves lives. And so getting people started on treatment is being measured, and how long they stay on treatment. The other aspect that Addiction Solutions, the whole team does, is helping patients access higher level of care. So Addiction Solutions does everything they can to support patients, but sometimes they do need a higher level of care. And we partner with Recovery Falmouth and some other institutions where we're able to get patients into care that desperately need it. And even with that, I have seen patients in my clinic in Newton Wellesley when they have come over for care off the island and then back in Addiction Solutions. It's actually a really important relationship that allows patients to have continuity, which is such an important aspect of addictions medicine. Finally, I wanted to mention another effort that we're hoping to bring very soon, but it is reaching our youth, so reaching our high schools. Not only the high school students, but their parents. I'm currently working with a pediatrician who is addictions trained at Boston Medical Center and the Graken Center, as well as a social worker who is addictions trained. And we go to Boston surround area high schools. We sit with the high school students and we talk about not only Narcan training and substance use, but the intersect of mental health and how anxiety and depression and peer pressure are all things that can lead to a student falling into a substance use issue. So that's something that we've already instituted. These slides and this work has been vetted, not only by all of us that we created it, but Boston Medical Center and the Graken Center and students. So that's something that I've been talking to Tim and Aline and Amanda and the rest of our team about bringing to Nantucket, and my two colleagues are ready to come over. And this is something that I think could be really, really important for the island to really reach the youth. And then we do a second piece where we talk to the parents and teachers after school to answer any questions that they have. But it's something that is really exciting. That's most of what I wanted to say, and thank you so much for having us, and thank you for hearing about the important work that Addiction Solutions is doing.
Thank you, Dr. Armstrong. Do we have any comments, questions from the committee?
Amanda had one last thing.
Just mention one more quickly about metrics. is that we've been in discussion around anytime I'm doing a biopsychosocial intake to do the PHQ-9, which assesses for depression, and the GAD-7, which assesses for anxiety. And then initially when they're first starting treatment, and then evaluating every 3 months afterwards. And that, data shows that it's important to evaluate those as well, because people may fill something out on paper where they may articulate something different in person. I just wanted to add that piece as part of the metrics. And we're also calling clients if they missed their session. Like I had a client today who missed his session, so I called him just to check in. He had forgotten about his appointment, but we just want them to know that we're here and available. And if they're struggling, we still reach out even though they don't come to the appointment.
Very good, very good. I have just one question, it was just brief on GLP-1. That is something I was completely unaware of. Can you just give us a brief explanation of?
I can speak to that.
That one.
I can speak to that because I think there was a little maybe confusion as to how this comes into the conversation. So in general, the GLP-1 medications, which are currently FDA approved for both diabetes and obesity, have been studied extensively in numerous peer review articles, and the NIH has now noted that they have an off-label opportunity, in particular for alcohol use disorder. So this is not something that myself as an addiction medicine doctor can prescribe because it's not FDA approved. But what we're seeing in the literature and in studies is that GLP-1s actually do help people with alcohol use disorder. This, I think there was a question about misuse. That is a separate issue. If people are struggling with weight and want to use a GLP-1 for an eating disorder, that is a separate medical issue, but that has nothing to do with the work that we're doing. We don't prescribe them, but the GLP-1s, just for everybody's to note that in the literature and in the world of addiction medicine, they actually are a medication that has been seen as a potential off-label use to help with alcohol use disorder in particular.
Okay, thank you for explaining that because I was a little bit confused and I have read some information on that. So thank you very much. Questions from the committee? With none there, I just want to say that I appreciate, we have Dr. Tim, Dr. Katerina. I see Alan is there, Amanda, Marcia, Aline. Appreciate everyone coming in today. Your application was extremely thorough. We appreciate that. And in my short tenure on CRC, the growth in your organization over the last 4 years is astonishing. And it's quite evident not only in the application, but in what you're doing on the island. And I know that back before Amanda joined you, we knew that it's important to have that counseling component. And I know that referring someone out, but there's trust that your patients have, your clients have, and to have that component as part of your whole package, I think is extremely important, because to say, here's a phone number, here, go across town or whatever, it just isn't going to happen. It's just wonderful to see. And again, thank you for all that you do. And thank you all for coming in today and taking this time. Very much appreciated.
Thank you very much for having us.
Very good.
Holidays.
We have Janice on.
All right. Have a good day, everyone. All right.
Freedom it's all over the place, down south in all of the gas stations you can get it.
Yeah.
You can get it on Island.
Non-FDA approved,
Yeah.
similar to Cat and Coca.
And it'll both those.
Bye, guys. I have to run. Thank you.
Very good.
Higher dose like heroin.
Yeah.
Thank you, guys. Good.
Thanks,
Very
Jericho.
good.
Happy Thanksgiving.
Janice, you're still there?
I'm here. I'm
Oh, we got you on.
difficulty getting on the.
Hold on, Jen, we've got you in a loop, so what I'm gonna do is I'm gonna boot you, please rejoin in a second. We got you in a,
I gotta go out and come back in.
yeah, I got you in a feedback loop.
Okay.
Okay. And then that one should be muted, and then she should join back.
Okay. Yeah, and thank you, everyone. I know it's been a long morning, but we've had some incredible interviews today. Lots of information.
Drinking from the fire hose.
Yes, definitely.
Just curious, how many more do we have to do?
This is the last
one.
And who is it?
It's Janice, Certificate Food, Fuel, and Rental, sorry.
Oh, thank you.
Yeah, I gotta go, so we move this one along, so.
Yes. This is our last.
As soon as she rejoins, we should be good, which of course it's now, oh, there she is, okay.
Okay.
And I would suggest we keep this directly to the asked questions and then do follow-ups from there.
All right. Janice, you with us? She's muted.
You should be good now, Janice.
You have to unmute her?
I can ask her to, but I can't actually unmute her from here.
And she's on an iPhone.
Yeah, my suspicion is she was traveling, she had some medical issues, and she has managed to make it in, like, it was a request for this, I think she had recovering from she had a medical appointment that interfered with the scheduling. I'm looking over our questions for this. The primary question was general updates on the circumstances with the food pantry.
Yeah, there was no really questions. It's just because I think it's operational to come in.
Yeah.
And this was before those questions were out before the announcement of the closure on. So it's possible.
If we don't connect with her, I do think, personally, I don't have any questions, but we could also reach out to her during the week and just, if necessary. Yeah, because she's not back on, and
I'll ring her direct. And then we've gotten essentially a couple of updates about the situation with food pantry. So I can definitely I'll call her right now and get her and let her know that we're good.
Okay. Alrighty. I think if we can, well, let's wait for him to just touch base with her, but I don't think that I have any questions. I don't know if anyone would have any questions. Their application was thorough, and with all the news updates on how the food pantry is moving along, I think that it's a capacity grant. So I'm not
I
sure.
have no questions for them. You know, the food pantry will.
Yes. I don't know if you, I can't see the screen right now.
I feel like we got a lot of information recently about them. I don't know where from.
Yeah, well, I think last week we did discuss the food pantry a lot, and between Jericho and myself and whatever, there's been a lot of press recently. They've got thank goodness a new home has come through, and it closed on the end of October, the property, and I know that there's still a lot of work to happen, but they do have a home, and that's the most important thing. And our funding is for Nantucket food, fuel, and rental assistance. It isn't just for the food pantry, but the food pantry is a big portion of what they do. Is Jericho?
He just stepped out of the room. I think he's trying to reach her.
Yeah, I think she's good. She's not showing up as joining, right?
Yeah. No.
It went to voicemail, but I'm texting her right now to let her know that she's fine.
Okay. Alrighty. So with that, we next Friday will.
think that might be her.
Oh,
Janice?
she's back on?
Hello? Can you hear me now?
Janice?
Yes.
Yes.
Can you?
Yes, you were muted before.
Yeah,
Janice.
no, I could see you all and for some reason it would not let me unmute. So now I'm on my phone. I can't see you, but I can hear you.
Okay.
I know I'm
Janice-
late. Go ahead.
Janice, we appreciate you having patience, and I know that you're off island and busy. But we were just discussing that your application was pretty thorough. We've had lots of discussion last week when we reviewed the grant. We have no additional question unless you want to give us just a brief update of where everything is on the new home, et cetera, but we
Sure,
don't.
I can be very, very brief.
Okay.
Because I think that was the only question. I'm
Yep.
sorry, I can't see you, but that's what it
okay.
is. Yeah, as you probably everyone on the island knows that the building at Boynton Lane was purchased by the land bank. And then subsequently it's being condominiumized with the Nourish Nantucket. And we will have space in that building. Everything is happening very quickly, but we anticipate, here's what we anticipate. We will be in the next week, we will be meeting with an architect, and we will put forth our wish list for the space and what we'd like to see in it and what we think needs to be done to the space for us to be able to occupy it. Once those initial plans are discussed with us, we will then go into negotiations with Nourish Nantucket about the defined details of the lease, the costs, who will pay for what. We are anticipating that we will have some rent payment. We are anticipating that we will be responsible for some internal, space reconstruction. There's quite a bit of stuff that will need to go into that. We are anticipating that we may have to purchase new or more equipment to go into that building. We're trying to put all of that financial data together so we can have our discussions with Nourish. And once that is finalized, construction will begin. And as you all know, not our goal, but our absolute must is that we are in that building by April. Hopefully it will be sooner. We will be moving the executive offices of Nantucket Food, Fuel, and Rental Assistance into that building, which will make for a more cohesive organization, better service to the clients. But that's where we are right now. We have a building, thank you, God. And now the fun and the hard work begins.
Well, thank you, Janice. And I know that there's been a lot of people pulling for this. So it takes a village, and
the village came through. So there you go.
Exactly. And even though, there will be rent, as you just mentioned, the offices moving into that building, some of the rent that was paid there will offset what has to be paid in this facility too. So in the end, it's all good. It's all good.
Yeah, it is. I mean, we're looking for, and as you've read the report, we're looking there will be some expansion.
Yes.
There will be some addition of staff. We anticipate there will be some addition of hours. All of that comes at a price. So there you go.
Exactly. And you applied for an operational grant, which, when we discussed that, this was one of the organizations that we said, this is what could benefit NIFRA.
Oh, yeah,
So-
absolutely. We're so glad you went that route.
Right. And your application was the best that we've ever seen. So thank you.
Oh, well, thank you very much. And one last I've talked to you for several years that at some point there will be some transitioning going on with the organization. I listened to Dr. Leprie's conversation. This is going to give us the opportunity to make some changes to the organization and hopefully let me step down a bit, not totally, but a bit. So I did not feel that I could hand that over to a new executive director. There's just too much going on with moving a building of this size, an organization of this size. But once that is done, we're going to move on with our transition plan. I hope to stay on with the organization, but I need a little bit of time.
Okay, well, thank you, Janice, and appreciate your time today. Best wishes and happy holidays, and we'll see you soon.
All right.
Alrighty?
I will be
Okay.
back on island tomorrow, hopefully.
Okay,
Thank
thank
you.
you.
Bye-bye.
Alrighty,
Bye.
okay.
All right, I gotta
with-
go. Are we done?
Yes, so with that, we'll see everyone next Friday at 9 a.m. We will be ready for deliberations at that point. Wednesday, the 19th, please submit your rubrics to Lexi. If you cannot do it digitally, you can call her and she can record, or you can scan it. But just get that information to Lexi by end of day on Wednesday, so she has time to not collaborate. I'm so tired,
Well,
whatever the word is, put it all together for us. So next Friday morning, we'll have that document in front of us. It's part of our deliberation, so please get that done. And thank you all for sticking with us for this morning. And we'll see you 9
One
o'clock.
question before we go. Wait,
Yes.
before we go. Can she send out the cheat sheet with all the guys, separated into two sections on it, how much we gave everybody last year, what they're asking for this year, as well as the rubric? Can we send it out, just that stuff?
I think you should have gotten that all already, but
I can't go back through hundreds of emails to find it. Can she
Okay.
just send those things out again, so I have it up on my email and I can print them out?
okay, Lexi, please do that. Okay?
Okay.
Okay, all righty. No problem, Linda. Lexi's here to help us, so we want to do that. All right?
And she's organized.
Yes, she certainly is. So thank you. Thank everyone. Have a great day, but I need a motion to adjourn.
Motion to adjourn.
Okay, we have first and
Second.
second by vote. I see Lee,
Aye.
John,
Aye.
Linda,
Aye.
Suzanne,
Aye.
myself, aye. So thank you very much. Have a great day, and I look forward
Have
to
fun
seeing.
down there.
Thank you. I'll send pictures. All right. Be well, everyone.
Take care.
Take care.
Thank you.
Too.
Thank you. Bye-bye now.